Well, we got it wrong, for instance, during the, well, this one doesn't have anything to do with the scorecard, but when we're having the, people also even got confused during the COVID-19 pandemic, when some people say the virus hangs in the air, some people say it's several meters away, some people said it's on the surface, it stays on the surface of tables and this. Even the health people got it wrong at a point, and we were all running around so scared. As soon as you got anywhere, somebody called, you are afraid that you are going to get COVID. So we play a very critical role, and we cannot downplay it. So the whole idea is that let's be part of this whole initiative. Let's send the message across that we can do something about our health system. The duty bearers who are the those who provide health service or health care, they also have a role to play. Community members also have a role to play, because some people, they refuse to obey instructions as to what they are supposed to do and what not to do. We are hoping that after this program, we will be able to pay attention. Those of us who have not been visiting sheep's compounds, we will visit. Those of us who have, there's a new initiative called community of what? The network of practice. It's a new initiative that Ghana Health Service is pushing, the network of practice. We'll be hearing about that one also, because that one involves all of those healthcare providers and the health service. We will get to know about that one also. So please, this is a learning care for all of us. I am also going to learn a lot more, and I'm hoping that we'll all be part of this, and then we'll carry the message that if you do this, if the health workers are not doing their work, we will be able to draw attention to it. They are open. The system is so open that they can't hide. Everything is online. You can see also what is happening on the grounds, so that we can get the messages across. So I want to end here by saying that you are all very welcome. It is a noble cause we are pursuing. We want nobody should die because of because universal health coverage is all about. To get there, all of us must play our role. The media must get the information out there where people can get service. And if somebody is not doing something right, we should draw attention to it. So that, and then if the community members also are ignorant about what is expected of them, we should be able to draw attention to it through our reporting, through Facebook and all that. So ladies and gentlemen, I am excited, and I'm looking forward to a very exciting and very engaging process time in the next 1.5 days. Thank you very much. God bless us all. Hey, is that clap for me?
You're not clapping, so even the table in the corner is trying to clap. You see? That's the reaction. Yeah. Great. And I'm so happy that Abinka made mention of one thing. It is the political season. But we know how much politics divides us. And then I know also that a lot of us journalists are politicians at the incubation. How many of us are into politics anyway? I know there are assemblymen here. There are MPs in waiting. There are special assistants. Yeah, but please, let the community scorecard, let us be united by the love of our community, because it's all in our hands. And our community is so badly divided, not only by politics, divided by even religion, not to mention galamsey and all the things. So please, let's be united for the purpose of the success of this thing, and all to achieve universal health coverage. Okay, at this point, let me invite for short remarks a rep of the Ghana Health Service, Mr. Divine Amania will be giving us a short remarks on behalf of the Ghana Health Service. Okay, so is the short remarks rep stepping forward, please? You should give the short remarks. So let's take the remarks from the African Leaders Malaria Alliance. Alma. Okay, so I'm handing over to Mr. Ayire, representing the African Leaders Malaria Alliance.
Yeah, thank you very much. So it's been a great pleasure, historic. This is the first time we are having a training of this nature in Africa. Alma is being led by the African presidents. Currently is the president of Guinea-Bissau, who is the president of Alma. And we support countries to develop these tools to propel the health strategies. Obviously starting with very effective in propelling the malaria agenda. So the former UNCTAH. So when we say RMNCAH, we are talking about reproductive, maternal, newborn child, and adolescent health. Because it was realized that maternal mortality was very high in sub-Saharan Africa average. And most of these bad, unfortunate indicators are recorded in sub-Saharan Africa. So the African Union needed to do something about it, moving away from the usual business into tackling things pragmatically in order to accelerate the reduction of maternal and newborn deaths. So that is why all these interventions came in. And we think that the media is very central in reportage, because the media can report something that is good as bad and something that is bad as good. So, but you can't blame the media. At least you need to involve the media in capacity building to understand what it is all about, so that together as partners we will be able to achieve the objective we have set before us. So we think this is very historic, and we are very happy to be associated with this, and also partnering with all the information that you require. If there are texts, there are video, sound. Thank you.
Thank you very much, Mr. Ayire, for that background. Well, it fills in a lot of the void that we had in our minds before. So we continue, and it's time for the presentations. We'll take our first presentation on Ghana's primary health care system, such that we can understand the CHIPS concept. And that presentation will be made by Mr. Divine Amania. Okay. Oh, please welcome him with some love, and let him present authoritatively. Show him that love. Over there. No, on that. Will you get it? Be on standby. Is the projector on? It should be showing on the screen. The projector is on. Has it been turned on? Well, if we do all that, if it's possible, why don't we do it? But then I think for strategic reasons, they also want it here. Otherwise, people will be tripping over it. Try test it.
bring the podium forward. Yeah, we just want it. Yeah.
I can't believe whose arrangement is that to have chairs tangling with power cables. Good morning. You are all welcome. This morning I'm presenting on how it started, where we are now. So chiefs, we are saying that community-based health planning and services. Community-based health planning and services, the acronym for chiefs. So we want to look at the background of chiefs. Chiefs is derived from the that was conducted in the northern part of Ghana in 1993. So chiefs came out from a research that was conducted by Navrugo Research Center in 1993, where planning and services, that's chiefs. The strategies currently that we are operating in the country was also initiated by Nkwanta district in the Volta region in 1999. So the research from the Navrongo Research Center was translated into operational mode initiative at the Nkwanta Health Directory. CHIP essentially evaluated area where they deliver health services, that is the health center positioned to the community level, where we have to move the health service delivery from the health centers to the remote areas or the deprived areas of the country or in the community-based setting. That brought about the chiefs in Ghana. So we want to look at the organization of health services in Ghana. I hope most of you know how the structures move in Ghana, the whole country. We have Ministry of Health and Directions for Health Activities in the country. Under the Ministry of Health, we have the agencies under the Ministry of Health. Some of the agencies are Kolebu Teaching Hospital, Konfanoche Teaching Hospital, and other regional hospitals that are tertiary hospitals. They are all under the Ministry of Health. So this is the structure, that's how it flows. And Ghana Health Service have all the regional hospitals under them. From the regional level, we have the district hospitals and the district administrations that manage all the district, the 261 districts that we have in the country. They are all under Ghana Health Service umbrella. Under the district level, we have some of the private hospitals that are in the district that manage the private sector as well. So at the district level, we move down to sub-district level where we have the health centers. In each district, we have minimally about 4. We use the geographic population to carve the sub-districts from 50. So at the sub-district level, they are there to provide basic curative care. Disease district level, they have the health centers there where they provide services. It's a static clinic where you have to level where we place the nurses in the remote, the last area where we have health service delivery in the community level. That's where the chiefs came in. The health system, primary health care starts from the district level, sub-district down to the chief zone. That's how the primary health care system works in the country. So this is the framework of how the health side, we have the district level, district health management teams that at every district that we have in the country, 61
All of them have a district health management teams. Then they also have district hospitals that manage the curative diseases and other things in the system. Because the DHMT is the system team that supersedes, that look over all the sub-district. They have administrative aspect, which is the sub-district team. Then they have the health centers that provide district. So under the sub-district, we realize that still there are some people that are not served with health services. So that's where the chiefs came in through the research. That how do we reach out to the whole communities, all people living in this country, how do we get to them and provide services to them? So all the sub-districts are now divided into zones, where we have the chief zones. So you can see that under the diagram we have sub-district and then we have chief zones. Just this example, some of the sub-districts, they have more than 2 chief zones under them. Today we are coming to learn about the community level activities, where you'll be going to look at the scorecard. So what is chiefs? The presentation, is that okay? Okay, that's fine. So starting from you, kindly read.
CHIPS is a community-based health planning and services, which means planning for health service at the community level and providing the actual health services at the community level. Should I continue? Okay. So these two processes are done collaboratively with the health sector and the community. The community plays an active role in the processes and not merely on their behalf.
Thank you very much. Here we are looking at chips. I know that some people write chips with CHI. Some write chips with CHIPS. Because it's an acronym from Community-Based Health Planning and Services, this is how we write it. CHPS, that's chips. Here the emphasis is community, that's the C. And then we are looking at the P, that's planning. So chips, the second one, we are providing the actual health services at the community level. Our nurses that are in the communities, the ENs, that's enrolled nurses, the midwives, all of them are people from our health institutions that have learned how to work with how to provide health services to the communities that they are living in. They don't just go there to provide health services. The CHIEFS program, the strategy is that let us plan with the community members and let them understand why we want to place the nurses with them in the community to help them to provide health services to them at the community level. That's the strategy. So these two strategies, they are the processes that are collaborating. That's why the scorecard also is a community scorecard. So when we get to community scorecard level, we understand what we mean by that as well. So CHIEFS is a set of health service delivery strategy that aim at delivering community-based health system. So now every community have their way of caring for their health before we are sending chips to them. So when you dialogue with the community member, help you to be able to deliver health services on the ground. So chips, we don't just go to them and do what we think is best. We dialogue with them. So the setup is that community-based health system should be strong enough to CHIEFS is a strategy to improve access to basic health services in all the communities. And the CHIEFS is also close to client. So I would say that since 1993, 1993, REF research at Navrongo where they place the community nurses in the communities to provide family planning services. And they have seen the success of that program. So it is translated from Navrongo down to Nkwanta. Then Nkwanta, the director there, took all the DHMT members in the northern region, now OT region. So they started it, and all the directors from Ministry of Health, the donor partners, they traveled down there to understudy what he has started doing there, and they decided that, oh, let us adapt this system to duplicate it or expand it to all corners in the country. So you can see this picture that this is a community health nurse in a family trying to provide services to them. They want to know their condition before providing. It's a system, it's a process in the chief's implementation. So we'll look at all these ones as well. And resources in the defined catchment area called a zone. So in each district, we have about minimum of 4 sub-districts. Under this 4 sub-districts, it's also carved living in a catchment area or 750 households in a community that is carved as a zone for the nurses to be able to work effectively. So here we are saying that in every community, we look for the leadership decision-making system that is there, the chiefs, the elders, the opinion leaders, pastors, imams, all these people that are living in the communities. We contact them, mobilize them, let them understand what we want to deploy the nurses there to do. As the understanding area that is demarcated with the district assembly and the health center in that catchment area. All of them work in hand to be able to demarcate the sub-districts into zones for the work of the nurses. These are some of the key elements of chiefs. We look at the community as a social capital. And where you came from, there's a chief zone that covers you, only that you don't know yet. But all of us in the country, we are all covered by that. Then the household and individuals as a target. So we have the community and we have different households in the community. And individual members of each household is also a target for health, to access health or to provide them their health needs. Then we look at planning with the community. The key here is another area, planning with the community. You don't plan and then just go and deliver it there. If you plan it yourself and send it there, it's for you. The community will not own it. Planning. As for the health, we have all the nurses that are coming from health institutions with their knowledge to provide the health. So now the focus is community planning before you deliver services to the community members. Community-based service delivery point that focuses on improved partnership with community leaders and social groupings in the community. Every community have social groupings. Some of them have keep fit clubs. Some of them have a market women association, funeral groups, a lot of associations on the ground. When we want to deploy chiefs to a community, you need to dialogue with all of them, bring them on board, let them understand what you are about to do, then they'll be willing to support whatever you are about to do in their catchment area. So community is a key, and the people there are also key. Churches, mosques, all the religious leaders, traditional leaders, all of them are key in the implementation of chiefs. So in a chief's implementation, the community health officer is another, is a community, in the community is the change agent. That is in the chief zone. It's a change agent. Why? Because they are bringing in a knowledge about health to the community members to help them curatively, to help them for preventive health issues as well. So they are change agents that are placed in the communities. That's what chiefs is saying. So the CHO represents both the sub-district health management team and the district health management team. His or her presence in the community connotes the president of Minister of Health and Ghana Health Service. So each chief zone, down there, they have authority from the Minister of Health and the Director General to be able to provide healthcare services at the community level. They provide preventive services, promotive services, safe motherhood services, reproductive health services as well, TBA, that's traditional birth attendance supervision. They provide supervision for the women that are delivering at the communities. They train them. And then they conduct simple deliveries as well at the sanitation, hygiene, and sanitation. When they are in the community, the focus is home visit. But the chief's concept is that all the nurses in the community are supposed to be moving from house to house. They have programs, agenda, that they move from every house that is in the catchment area. They have to visit it before the end of the year. Every year they have to go around and visit all these houses, check the vitals of BP, sugar, all the diseases that they can allocate. Has given the nurses opportunity to go to every home in the catchment area that they are being deployed to or allocated to them. So we are saying that the CHO is representing. Am I repeating the same thing? No. Okay. So we want to look at how chiefs, pretty units of chiefs is called a zone. So chief is called a zone, where some of the 6 milestones are established and the CHO is deployed to provide health services. So we'll give you some materials that you can read about. Now you can go to the internet as well and search about chiefs in Ghana. You have a lot of material that you can read to understand more. So today we can't give you all the apports that you need. So the second one, we are looking at completed chief zone, where all the 6 milestones are established. We have 15 steps that are developed to implement chiefs in the country. And these 15 steps are grouped, and or if you are able to finish all the 6 milestones, then your zone is complete zone. So these 2 names, functional chief zone and then completed chief zone. All chief zone. You selection of communities, dialogue with the health workers. So here, for the chief zone, have several communities that come together to form a chief zone. Did you understand that? Now, how you sit. Let's say every seat is a zone. The individuals are communities that sit around this zone. So for you to establish, this is a seat, table number 1. It's a chief zone. For us to be able to work in this chief zone, we have to make sure that we mobilize all the people from these 5 communities to understand why we want to bring the nurses to them to help them provide services. So we dialogue with all these people. They all have chiefs and elders and the leaders in all these communities. You don't just come to agree that put the chief zone here. Can you all see me? Let's put the chief zone here that all of us we can access. So if you don't dialogue with them to understand why you are bringing the chief zone to them, and you discuss with only this community 1, and you place all carved into a zone, so they are supposed to work together to provide services. The next will be where they decide that they should place the next, because sometimes communities are like that. They have different differences. So if you don't dialogue with them for them to agree before you build a compound very well, they all decide that put the compound here. And this community will give you somebody called volunteer. This community also supply volunteers all. Then they also give you CHMC members, Community Health Management Committee members. We'll get to that level. So have this picture in your mind before we continue. Am I making sense? Thank you. So we look at the planning with the community members to select the communities, dialogue with the health workers. When dialogue with the health workers, every district government has employed several nurses to work in the district. You don't just force the nurse to go to a community to go and do chips. You have to bring them together as a district director. You want to, most of the district now, they have more than 20 chip zones. So you discuss with the communities to work. Then they will agree voluntarily to go. When it happens that way, and you send the nurse to the community, she'll be willing to stay there and work. But if you force the nurse to go to a deprived area and she's not willing, she can go there and then. Okay. Yes. 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 Question again.
What I'm saying is that we know there are community health workers
Yes.
who have been trained in this concept, like being in the community, close to the people, going to their homes to speak to them, among others. And you're saying that the DHMT must meet with the nurses, speak to them, and who decides or willingly wants to go is allowed to.
Yeah.
What happens to those who were trained purposely for that? Or it's those people that he still has to have the meeting with?
Yes.
If it's yes, they knew that they will be serving the community and they chose that cause. Why are they not willing to go?
That's human resource issues. That's why we need to let them understand that from school. Some of them, they learn part of chips in school, at home, sometimes 2 or 3 years before they are employed. So some of them, their status begin to change. Their understanding, the focus changes. So you have to bring them together, let them understand that this concept is saying that get to the community and work. As at now, it's not only the community health nurses that are in the chip zones. We have road nurses that are in the chip zones working. We have midwives that are there working because they understand that they have to be there and work. And some of them are willing to go there to work. So when a director DHMT discuss with them, let them understand the concept very well, so they will be willing to go. The challenge that we are seeing as at now is that some of them, they have not gone through the chief's training yet. What they did at school, some of them are forgotten. They need to be reoriented by the district directors, let them understand the concept, and go into the community to help the community members and mobilize the community well. So it's a key issue. So all the
few weeks ago, I was doing some work around the Upper East region. So, and it has to do with this chips stuff that I was doing. So I toured a number of chip zones.
Yeah.
Now, the issue is that in the Upper East region, and out of this number, you realize that it's only about 320 or so, not chip compounds and maybe polyclinic and stuff.
Yeah.
But the remaining zones, there are no chip. One of the communities that I went around Pusika areas, Nyariga, realized that that particular community, it is deprived in such a way that even accessing the place is not easy. But the Ghana Health Service has been able to post a nurse, community health nurse, into that community. And the person has been going there to offer services to them under a tree. So if immunization and other things, then she will go. So, but she doesn't stay there.
Yeah.
She only goes there when the need arises, then she will go. So what the community people have done is to form this community health volunteer management concept, where they train the members, they go around to offer basic health, needs and other things to the people, and also talk to them. Now, the challenge is that it's not only that community. The concept, that particular thing is all over. But I don't know if it is acceptable that you zone a place for chips and there's no facility there. Then you go ahead to post people. Even that particular nurse has been very distant. She has decided to go, but I'm told that some of them, they don't go.
Yeah.
They will assign them there, but they will not go.
Yeah.
So are you not worried about that?
Yeah, that's fine. Yeah, we are worried about it because the nurses are supposed to be deployed, not to post. The difference between deployment means that you bring the nurses to the community, hand them over to the chief elders after your dialogue with the community members, after the community entry. After you have done proper community entry, that's the DHMT, the district management chiefs is about. For instance, that community that you are saying that is deprived, they have their children outside. All you know, they have some of them outside the country. If you dialogue with them properly and they understand why they should have chiefs, some of them could send them money to build the chief zone. That even though they post some nurses and they didn't go, that's why they need to dialogue with all the nurses before you send them. You don't just force them to go. Some of them cannot go. Because that place, I believe you have to cross some streams before going. And some have never, they came from the mountains. They have never gone through any river. So when you send such a person, it will be difficult. So you need to dialogue with the people. Let them understand the concept very well. Encourage them that their work, the purpose for their employment is to be with the people in the community. Then before then, you have to dialogue with the community members to accept them as their children. If you don't dialogue with the community members, they see them as one of the visitors that are coming. Yes.
We want the people in the community to accept the health workers we post there.
Yes.
For easy identification and acceptance, why don't we advocate for community nurses? I mean, people from that community. Let's say if it's Abukobi, that we want to do a chief thing here, then we look at nurses from this area, because if everyone knows Ivy in the Volta region, and Ivy is coming to speak to them about a disease and other things, she speaks their language, she understands them, she knows their culture, other than bringing Ernestina from the Ashanti region to the Volta region. That's a suggestion. Thank you.
Okay, thank you very much. I believe, let's finish that. Write down your questions, then we can answer those questions for us to be able to finish early. But for you, that question, let me just answer it. When the chief started at early stage, district assemblies sponsor people to community schools to go back. So district assemblies have stopped sponsoring people to the nursing schools because they realize that the people, a lot of things are happening, politics, a lot of things. So after the school, they don't want to go back to those communities. So in the operation of chiefs, we look at community health compound. That's the chief's compound. Here, the chief zone is different from the chief's compound. Yes. Okay. A zone is a demarcated geographical area. But the compound is where they provide the service delivery point, where the service is supposed to deliver from. Or the chief's compound is supposed to house the nurses and the service delivery point. So that's where their residence is supposed to be in the community for them to move from there to the community members to work with them. So the compound is different from the zone. So here in the picture, you can see that there's a compound they built for the community members to dwell there. Then we'll look at another component of another milestone of the chief's implementation. That is essential equipment that are needed for chief's implementation in each community. We'll look at motorbikes, bicycles, and the BP apparatus, scales, coaching, and extractor, effectively. So these are some of the milestones that we use to establish our selective and train and deploy to the chief zone. As at now, it is not only community health nurses that are deployed to the chief zones. We have enrolled nurses that are willing to go and they are there. We have midwives, as I said, trained to go. So it's a process. So this 6 milestone are activities that you have to go through as a DHMT to be able to establish a chief's compound in each particular place that are willing to accept chiefs. So here is, and these committees, we have volunteers group, and we have community health management groups. Community health management group have chiefs, queen mothers, pastors, imams, retired teachers in the community, headmasters in the community. They are supposed to be in this group. So they need some people who can command authority in the community to be part of the committee. Volunteers group, there are two groups. Volunteers group are different from the management committee group. The management committees are also volunteers, but they need a special knowledge to be able to help. They have their expertise that they can use to help the community members to understand when there's a need to mobilize. So we want to look at the key stakeholders and the structures in the community, in the chief's operations. Here we are saying that the DHMT give directions, provide supervision, and service provision. They provide everything that we need to be able to deliver services at the ground. Then we'll look at the sub-district health teams. Also, there are liaisons between the CHO and the community members, and they also provide supervision for the sub-district health that supervise the sub-district or health activities in the sub-district. So the CHO also provide education, service provision, referrals, and diplomacy in the community. The focus of the chiefs is that as the CHOs are living in the community, they detect some of the diseases that they have their levels to. There are some implications, complications in the childbirth. You need to identify the situation and refer the patients very health education, hygiene education, sanitation education, provide some services, minor services to the community members. Then we have the TBAs as well. They work with the CHOs to provide services and the referrals. Then we have volunteers that liaise with the community-based surveillance people. They also provide education, as my brother have said that he was doing some work in the Upper East and noticed that the community health programs, referrals with the, and provide community health compounds, and plan all these activities with the CHO on the ground. That's why we need to look at the CHMC members, the type of people that are in them. Every district is demarcated into zones. After demarcating the whole district, they begin to roll the chiefs out through the area, assign a nurse to be providing services. Then you go back and look at what you should do to establish that place, make it very effective, functional, and complete. Then we also have private providers in the communities. And these private providers, you make sure, the CHOs make sure that they work in partnership with them. They are not rivalries on the ground, but rather they are all providing health services. Every chief zone is carved around a electoral area. Political wings that will advocate for chiefs implementation in that community. So we carve the chief zones around them. If there's an assemblyman that have a bigger electoral area, that area could have 2 chief zones. So the assemblyman or the woman is the political advocate for the chief zone. That's why we carve it around them. So the liaise between the community members and the DHMT and then the district assembly for any resources that is needed in that community. So the district assembly in each district also support the construction of the chief's compounds, training of the community members, community health management teams. Some of them, the CHOs, the training the assemblies are supporting to be able to help the health service delivery at the community level. They also help in some of the logistics that are needed at the chief zone level implementation. Some of the zones that are carved, they have vibrant CSOs in the community that are able to support them in different ways to be able to implement the chiefs at that level. So this slide was prepared very long time ago at 2011. A country chiefs implementation in all the whole country. That was our vision as at that time, 2011. That by 2015, the whole country should have chiefs implement access to healthcare and service, the continuous expansion of functional chiefs in all regions. A profound effort has been driven in large part by increasing district assemblies. There was a time that the government made sure that they taxed all the district assemblies to provide compounds for the chief zones. So as at now, as at that time, 2011, 2022, thereabout, that we started implementing the chiefs from Nkwanta experiment. The pilot was scaled up in the whole country. And as at 2020 chief zones, we have 80, about 2009, we have 868 chief zones. Then by 2010, we have 1,037 in place. By 2011, 641 was added. So from the time of scaling up of chiefs up to 2011, it was moving rapidly in all everywhere in the districts. So as at 2011, we have about 1,675 as at December 2011. That's where we have functional chiefs in the country. Yes. The compounds also is there. Here, if you look at this graph, from 2002 to 2011, 2002 we're having only 39 chief zones in the whole country. And those 39 were having facilities all over the whole country. Then by 2003, we have 55 chief zones. 2004, we have 84. 2005, we have 190. By that time, the whole country will have about 110 districts at this level. So as the districts continue to increase, the chief zones also continue to increase like that. So by 2011, we have about 1,675 zones in the country, functional chief zones in the country. So you see that looking at this implementation at 2011, we were having 4,217 demarcated zones, 217 zones. After that, then we begin to roll them out with all the logistics, posting nurses to the communities, providing the logistics, motorbikes, facilities, build. So that 1,675 functional, most of them have compounds. Most of them have compounds. Yeah.
Chip compounds.
Yes.
The question has to do with the chip compounds.
Yes.
Are we saying that as at 2011, the chip compounds that we have, they are equivalent to the chip zones? What is this figure?
No, not all of them have compounds.
So what is the figure as at 2011? And if you can update us to today.
Okay, that one I don't have it here, but before we leave here tomorrow, I can give you that figure. So as at now, March 2024, we have 7,353 demarcated chip zones in the whole country. Now we have demarcated the whole country into zones. So after demarcating, we continue rolling out the functional. So as at now, in our database, we have 5,205 functional chip zones in the database as of March this year. So it means that if you look at the gap between demarcation and the functional, it's almost about 2,000 zones that are demarcated. Some of them that are providing services, like how the gentleman has said that he visited some part of the Upper East and saw that some of the chip zones are under 3. Those under 3 are falling into this. The focus is that we have demarcated the whole country. Now let us see how best to roll them out gradually and make sure that every corner the chief compounds are there, to provide, the nurses are there to provide services. As at now, all the demarcated zones have at least one nurse providing services there. But some of them are not staying there because there's no facility to stay there. So the focus is that let us dialogue with the community members, philanthropists, the donors that will help us, help SETA to provide those compounds as well. So as you are moving from here, you'll be our advocate to contact some of the donors, that your writings will prompt some of the people, rich men who come from some of the communities that are living in Accra, Kumasi, outside the country. They can see your writing and be willing to come and support us to be able to roll out the program. The roles of civil society organizations to be able to lobby the government, regional coordinating councils, district municipal assemblies, and other partners in health to support us, provide the logistics for chief zones, support construction, need resources to train them, to understand, to know what exactly they should do. Like formally, this is the first time I'm seeing all the journalists, most of the journalists leave. From here, it will go on. Some of the regions will decide to mobilize resources and train other people in those districts to help the system. So we are saying that the CSOs are supposed to support the DHMTs in the community and the opinion leaders in the community to explain to them the chief's concept. So the CSOs in the communities, the district are supposed to help them to be able to deliver those services, are supposed to organize debates for community members. When we organize a debate for them, then we invite the community, the CHOs to come and give health talks, provide health services to the people in the community. Then they also help in selection of community health management committee. The people who have voice in the community to become members of CHMC so that when they are talking, people will listen. Because most of the CHMCs are supposed to have people listen, to be part of this group so that they can. And then CHO as well. Then we are saying that the CSOs are supposed to have also plan with the community health management committees on health to carry out the health activities. And then sensitize the traditional authorities, political institutions to understand the chief's concept. So as you are here today, we are just trying to share these ideas with you so that when you go back, go into the system, we have a lot of information on the net. Search for it and read about it. Take chiefs as your baby in your community interested in. So we are saying that you should support also. So now, the vision of Ghana, the vision of Ghana roadmap for attaining universal health coverage by 2030. We are now in 2024. As at 2020, Ghana 2030, we need to move with this vision. So we are saying that Ghana defined the universal health care as all people in Ghana have timely access to high quality health services, irrespective of ability to pay health coverage by 2030. That's brought in several innovations that 2018 scorecard, our sister Asay will come and talk to you about the scorecard. Then we are all trying to all these are leading to, for you to have the interest in the chiefs. There are a lot of initiatives that are going on about chiefs. So as you have the interest, then Ethiopia, Kenya, all of them came down to Ghana to learn about chiefs. Nigeria, they came to learn. And so if you are here promoting chiefs, scorecard, all these things, writing about it based from those ministries that come and train our people for us there. So it's a tax. Take it serious. In conclusion, I'm saying that we need to collaborate and plan with the community strategy, to collaborate and plan with the community structures through effective community entry processes, implementing chiefs required I can't even get my slide. Okay, fine. CHIPS is a vehicle that carries all health programs and activities to the community level. Okay. Thank you very much.
Okay, before we continue, please, if anyone has a question, please wait for the mic to be allocated to you before you ask the question.
So, yeah, now the question is, you can ask questions so that I'll try to answer.
Say,
Yes.
please, which equipment are in the CHIPS compound?
All the equipment that are used at the health center, clinics, majority of them are supposed to be there. We need to have about 29. It depends on the facility and the type of people that are there. Some of the facilities have midwives. That we have designed is 29 equipment, and I cannot mention them one by one.
Okay, how many beds?
But BB apparatus is part of it.
How many beds?
Beds is one for resting. It depends on the size of the facility.
So this leads to my, let me say, discovery. That many a times we do stories that nurses at so and so CHIPS compound appeal for help. They are saying that there is only one bed at the place. Then that we've had today, it means that they have a standard. Sometimes that is what they are supposed to get, and not that they have been deprived. That is what I wanted to drive our attention to. We will be there, we will see stories. If you just see CHIPS compound and you see the midwife, you know very well that when they call us, then we also remind them that you know this is what you are supposed to have. So do not see this as a deprived.
Yeah. So that is very good from you. Just to add that, when he was presenting, he mentioned that CHIPS is the basic unit. And he also made us to understand that their main duty is home visits. They are not supposed to be sitting at the health facilities providing service like health centers. The only person that can sit there and provide service is the midwife, because now the policy is adding midwives. If you have 2 beds there, it's okay, or maybe a maximum of 3, because at the maternity lying in, so the mother can go there and rest and breastfeed the baby until she's fit enough to go home. And then the 3rd bed is the one for emergencies. If they want to detain the person, give some, there are a lot of things they are not supposed to do. So I hope we get it now. So you have the CHIPS, then we also have communities, and then more staff, more beds. And then the other CHIPS zones, we cannot have a lab there. What they do is those rapid tests, the RDTs and those things. They don't give infusions. So we need to understand some of these things. The communities can demand more, but when they are demanding, we also need to remind them that if you want an upgraded facility, you make efforts, self-initiative, and then contact the government to give you a bigger facility. But you can't be demanding that the CHIPS zone does so many things the other areas will do. Thank you.
All right.
The mic is here.
All right, boss. Now I want to know whether the CHIPS compound, whether you do give them some money to at least address some petty challenges at the facility before, if it is beyond them, they ask for external help from the assemblies or a place called Yongwasi. As I'm speaking to you now, they have a very nice CHIPS compound, but I understand they said there's a leakage. So they have, I went there, that was last month, I reported on it, and we even aired it on our network, GTV. So that was last week. I called the assemblyman over there to find out whether the problem have been solved. It's up to now still. So if it's only leakage, I don't see the reason why they should vacate the place. And I understand the people over there now, they have to travel to the nearest village called Obopa before accessing healthcare. So I want to know whether you don't support them at least some setting some easy impress or whatever quota to at least manage certain challenges before.
Okay, I would like to say that I don't know whether they have a DHM community health management committees in place. They are supposed to have community health management committees in place, not volunteers. Community health management committees have pastors, imams, chief, and elders in place. So that committee is supposed to see to all the welfare of the facility, all the nurses that are there, they are supposed to care for them. So if they don't have any effective CHMC there, that's why they are suffering. Because if they have the caliber of people that are supposed to be in the CHMC, they wouldn't sit down. A pastor and the imams will not sit down. That place should be linking like that if they come for meetings. So that's the reason why we need caliber of people to be in that committee, church people to support. Imam can say it at the mosque and they will support. Because they know that that catchment area, all of them are there to access services. Now the clients are all traveling from that place to another place for services. Look at the expenditure that they are spending money to go there. If the CHMC is very effective, and this assembly is so one, if any money that comes to the CHMC, CHOs, some of them are for buying small things, not for repairing of such a big things. Am I clear? Yes, they give them some space coming to help us, how we involve the communities to be able to help the system to operate effectively. So my brother and the secretary to mobilize the community for that work is very key. Okay, thank you very much.
Yeah, thank you very much. Sir, if I got the understanding well, the chip zones are supposed to be a cluster of chips compounds. So if that is it, ideally...
Not a cluster of chip compounds.
Okay.
A chip zone will have one chips compound.
Okay. Mm-hmm. Or a chip zone will have one chips compound.
Yes. There are several communities forming the zone. It could be 5, 7 communities. One should be one for all of them to access.
Okay, so the zoning is the communities.
Yes.
With using one facility compound is ideal.
Yes.
Okay, thank you very much.
So even the zoning, the district assembly are supposed to be involved with the health management team to be able to demarcate the zones, so that they will use it around the electoral areas.
Then
electoral area is supposed to be a chip zone now.
It have a chip zone.
Then a follow-up to the question that my colleague asked, that a chip compound is not functioning. And then you said the CHO, community health. So does the district health management team come in? Because I know they have the oversight responsibility.
So let's also appreciate the situation we are in. I think we all know that currently GOG funds, I think we all know what GOG funds are. MMDAs. But these days, this funding is not coming forth. So most of them are providing service and then under NHIA and are supposed to be reimbursed. And I think we also know the challenges here. So, and that is what has depleted the funding situation. So, depending on the areas, they have different way of managing the impress and then the amount based on their strength. So, the facility you are talking about, either they do not even have any funding to support them. That is why. So, the community health management committees we are talking about is something that is supposed to be in place, because we'll be crying, our people will be dying, and we are the same people. So that's why we want to ensure that the community health management committees are effective so that they will be able to assess what is going on and see if government is not able to do it and it's affecting health delivery, what can they do to ensure that they do it properly and understand the role they are playing. And then we can also use that as part of the advocacy to encourage communities to rise up to the challenge to solving some of these things. You may not know what they need to fix this might be about 300 Ghana cedis, which one member of the community or even the chief can solve. But because these systems, thank you.
This picture, can you all see it? We are saying that chief is a vehicle. Let us support it. You see, this donkey is the system that is carrying the goods. But because this man, the ones passing, all those standing there, they don't know what is happening to the system. So the load is on the system, but they can't support it. That's what is happening at that facility. People don't understand why the facility will be there and we have to support it. They are expecting government to support that it will raise up the vehicle. So let us support the vehicle to be normal to carry the goods to the doorstep of the people in the community. So pick this picture in your mind and support the system.
Yeah.
God bless you all.
Yeah, that's it. Daddy, last one. Yes. The yes you ne kakra wo ye mama hu say ye hwe chips ho yi a ebeboa pa ma yarwa bibiri aba form. I'm saying this because I'm coming from the district MPOS disease in no year no case in no they were able to report to the hospital very fast. And no nema itimi so ano sanya sanka MPOS no nka enka bula fa baby a nti ye hunu sa no mesre case ni see from region national all over Kasa Abegu district ni mu ho no mo koba no enya agro nti ya na pese to da medwen ho se mo pese jama BBC because eba ye twasika kese Yema radio time okra na oji om kakra fufuola. They don't want to pay. But ya we ba ye no, I'm the marketing manager at the station. Omo di sika ba say yembo advert ni emfanya education. Kwasa wo mom 1 hour at least a month in just 500 Ghana to support fuel you kra na say light bill. Omo say omunisika. And so ya we ba ye no, 2 months I'm taking 18,000 for radio a comment director ho. And see 18,000 for 2 months commercial played on radio. Enti ya besre ya en kosoro enye kese ma desre de kakra no. Amen.
Thank you very much.
Hello. I just want to encourage everyone here. This CHIPS concept is very important. If in 6 years' time, we are supposed to accelerate universal health coverage, everybody in every community will have access to help, I think we must get on board. I'm bringing this on board. I remember about 2-3 years ago, we ran a project, ECOWAS project, and it came, I had to travel to Chate to the community. You will weep. It's an untarred road, and the people are behind the bush. When we got there, they don't have a, what do you call it, a licensed chemical. People who sell drugs, yes, over the counter. They don't have over the counter facility. They have no functioning pharmacy. All they had was this CHIPS compound. And the community is large. Everybody has to access health care there. So I went there to do an interview. And I saw what people go through. When you are living, you know, when you are crying, you take things for granted. But when you go into the deprived communities, the things that we see there. And so it dawned on me, I did a story. I did an article. And then it won an award at first, and then I was the runner-up. And I had, let me land. We were not paid in cedis, we were paid in dollars. Better, am I telling lies? Better is here, a media outlet I write for. Once we got dollars. It's not so much as I didn't even do the story because of award. I didn't even know we went to politicians. I went down to the grassroots, saw what was happening there. And then I did a story. And then I won an award. So our coming here today is to call, if 6 years we are going to make sure that everybody gets access to healthcare. When we leave this place, I'm pleading with you, my colleagues. We are journalists. Please go down to the community. Those coming from the regions, Accra, Aboko, be everywhere. Go down to get the real story. People are suffering. Women are suffering. They have no drugs at the CHIPS campus. You go there, when I went there, they don't have stock out. They don't have drugs. They only give you malaria tablets. You have to go to a higher facility, maybe go to get all those things. So please go down to the human interest stories. Bring the report out. So please, I'm pleading with you. Let this training not be in vain. Let us come here. Let us contribute our quota to these counters. So I think we should break that barrier that this time we are taking things in our hands. Please, this is my little contribution.
Thank you very much. I would like to suggest that all of you try to visit Ghana Health Service website. Type CHIPS. We have the policy there. We have implementation guidelines, other materials on CHIPS. They are all there. Try to read about it so that wherever you go, you can write properly. You can talk to it and advocate for the CHIPS program for more resources to implement CHIPS in Ghana. Thank you very much.
Ma'am, please, the last one, my contribution. Yes, I'm here. Okay. Yes, when I moved into the hinterlands, what I realized was that Ghana Health Service has been able to gag the officers in the hinterlands, so they will never speak to journalists when they are contacted, and it makes authentic. So please, if you can talk to them when journalists come with IDs, they should talk to us to make things easier for us. Thank you.
Thank you very much. I believe that after the scorecard training, you know the people to contact for more information, because the scorecard will help you to understand what is on the ground, how to get through to those, to get the information that you need about each CHIPS zone. Yeah. Okay. No. We want, yes. Okay, that's fine. Sir.
I want to suggest this. When we were doing the issue about the RTSS drug implementation project, I don't know how you did it, but each of the time we went to the communities or any of the health facilities, all we needed to do, for instance, for the voter, and he would tell the officers there that they should grant or allow us to do whatever we want to do. There was a time I went to Keta and they declined entry to the facility. Immediately I called Jokoto. I think somebody called from Accra, from Amren, and quickly I was allowed to go ahead with it. So I think it's just a matter of establishing the right contacts for us, and be on standby anytime we face difficulties. We can reach out to you, then you reach out to them quickly for us. 2 weeks ago, I was in Dambai, in the Oti region, for 2 good days. The Ghana Health Service would not allow me to speak to anybody, any of the officers. So the story was hanging. Then I had to go to the community perspective, and even that, because I needed the Ghana Health Service to give me some very vital information. That way I could go ahead with the story. They would not. Finally, when I met the director, I said, I cannot speak on camera. You know, we are in hard times. I said, wow. Yes. We are in hard times. I said, whoa. Then the director off camera told me a story, very interesting one, but it still couldn't help me do the story because I needed her to say something that would really push what, like the narrative that was all out there. You won't get. So that's the difficulty with most of our workers now, particularly those in the public sector. Very difficult to get them to speak.
I would like to say that none of the, so you can't contact them, they will not tell you anything. So you better go through the channel. When you are visiting a district, make sure that your presence is fair and how to do. They will give you their numbers. When you are down there, if there's anything, you call them, that they know that this person, this media is in their community. So because of how people are forging things and writing things that provoke people, they don't allow things. So if you contact the managers on the ground from the district level, they will instruct the sub-district and then allow you to get to the facility that you are going. So let us follow protocols when we enter the community level, when we enter the district, so that we'll get the information that we need. It's easy. I believe so. Thank you.
Thank you very much. At this point, we want to thank Mr. Divine Amania. He's the Deputy Chief Biostatistician at the Ghana Health Service. Fantastic. I believe there's a lot more we need to learn, but I believe we are thirsty as well. So let's go quench our thirst with the tea that's ready. And we meet in about 10-15 minutes time. So I'll see you soon.
have been on for an initiative have been around for a very long time, but they are not. I don't think we have many journalists involved. There. Some may not even have heard about the Chiefs Campus Initiative, which is supposed to bring health to the doorstep of people. So there's a lot to be done. And so when the Ghana Health Service decided to embark on, they've been doing a lot already, but still the gap is wide between those who need the service and the service that is provided. And we also know that research has been done in this country that shows that many people rely on the media for information on health. They make critical decisions about the kind of medicines they should take, where they should, from any effort or all efforts to scale up universal health coverage, that we will not get any. The African Leaders Malaria Alliance, who are the initiators of this scorecard, and then the French government, Expertise France, who are funding the project for the next, I think the next 3 years or 4 years or 5 years, to make sure that we scale up this whole idea about the community scorecard. So that it's not just the people who are providing health service, but people who are receiving the care, to find out whether to have a conversation, to go around the community to make sure this is being done. It's the media. So the initiative is very interactive, and we think that the journalists must not only report on health issues, but must be partners in the whole process to get health to the doorstep of the people. So for the next 2 days, we are hoping to walk through the whole process of the whole process of the scorecard initiative, what it means, but we need to be engaged more in the process of scoring people, finding out what we are doing. Are you doing enough? They don't have this, they don't have that, they don't have that. Is it that it is not there, or because the people don't know? And if we are saying that people really, and to be able to seek information, to find out from the people, to question people, to seek accountability with the Ghana Health Service, to push this agenda, that journalists are critical to the whole process. And if they just see us as journalists and people who come and report, then it is a big loss of heavily engaged in the process of the healthcare delivery. And the key to universal health coverage is the community scorecard initiative, where everybody will be on his or her toes to make sure that what they are supposed to do, the healthcare providers and those who are receiving, and also sometimes we always complain about the community. Sometimes we always complain about the healthcare providers, that they are not doing this, they are not doing that, their systems. People don't even, some diseases they think is the visitation of the gods and all those kinds of things. And so where they are supposed to go and seek health care, they don't go, and until it is too late. So when you arrive there, you don't get the care you need, you die, then they blame it on the healthcare providers. So we also have to deal with the issue of ignorance. Our belief is not good. But how much of what do you take to be able to treat a disease you don't even know what is happening to? So we need to work on community members. Then you blame somebody. So there's a lot of work to do. If indeed we want universal health coverage, then both the people who are providing the service and those who are receiving the service need a lot of education as to what to do, because we all have a responsibility. Those who are providing the care and those who are receiving the care. And we also we have a responsibility to speak up when people are not doing what they are supposed to do. And that is the job of the journalists. We are the eyes and the ears of society. We must be present when it is happening in real time at the health centers across the country. And we are hoping that the people who are here will be assigned to this other partners who will be doing training, will be assigned to the partners, they'll be part of the training programs. And then the journalists will also have the opportunity to go to what people have said that they are going to do, are they doing it? So it's a whole package. We are hoping that we'll be able to do some kind of webinars and all that, so that we are all Ghana Health Service people, but other people who are the coalitions on health and all that, who are doing other things, they are all part of the process. So we will all be together as partners, and not just as reporters, but as partners, so that together, if we don't achieve the...
I would like to find one of the challenges that the media always encounter when you visit the ground is getting the people to speak to.
Which people are you talking about?
The right people at the community level.
When you say people, is it the healthcare providers or...
Healthcare providers. What is your network doing so that we can deepen that collaboration?
That is why we are here. We are going to have directors from the Ghana Health Service and others who will be here. So because we have all our issues will be raised so that they can answer. Because there's no point coming here to learn about the scorecard. As will be coming here, he's in charge of the project. We'll be coming here later to join us, and then we can have a holistic discussion as to how we can. Because when they begin to see us as partners, then the conversation changes. But if they see us as people who are just inquisitive and they are coming to us, why haven't you done this, haven't you done that, then they resist. But the difference is, if you are a partner, you talk to a partner. But if you see me as somebody who is coming to harass you, I will shy away. You know, scientists usually are worried about journalists because they think that we don't understand what they are doing and will spoil their projects and things. But if they know that we are...
So please, Divine 2 will be here. The three of us, we would come round to help you set up. So who has received an email? Yes. So have you been able to set up? You did. Excellent. So who else? And then those of you who are very smart, once you have set up, go to Scorecard, you'll find it. Country Scorecard. Download it and use the same credentials to sign up. Your phone, tablet, whatever. So please, if you have gotten the email, if you haven't gotten it, check your spam. We haven't checked your spam. We haven't finished everything, but we've done more than 60 to 70%. You found it in your spam, move it to your inbox. And then where it is saying here, you click, it will ask you to create, it will tell you your username. Some of you, your username, your new username, if it has been changed. So you use a username and then the password you have, created to activate the system. And we have given you the national platform so that you can see everything. And you can also go down to see your respective regions, sub-districts, and so on, and communities. So who else have seen it?
What are you trying to log into?
Those who haven't seen, probably if it has been created, just check yours. 50%, we can get it. You've gotten it. Okay. And you? Okay. Okay. This is why we are here. So we need to get it. And you need to get it right. No, we've done a lot. So we've done more than 80. I see you did how many? 1. Making it 30. And then you've got it. Good. And then who else? This table. Who else? You've got it. This table. Good. And then this table also has. And here? Do you have it? Excellent. So this table too has. This table, you have it. And here? No one yet. You wrote on the same sheet. Okay. So, okay, I think, has this table, anybody here gotten it? You have to create a new password. Yes. So it means this table too, you have it. And here? Nobody here yet. Yes. So I think I would, maybe you can start now. There are just 2 tables without it.
Okay.
So that I will
Finish it. Okay. Yeah. So please create a password that you remember. There is not any personal information thing that you need to go and put any high security. So any password, if even someone gets to know, a password that you can remember.
You'll be reading from your We're all refreshed and ready to move on. Yeah, we're having our next presentation. And it gives an overview of the Expertise France Community Scorecard project. And it's going to be made by Madame Aseye Bodochi. She is a senior health planner at the Ghana Health Service. Okay, so your audience.
Thank you. Okay, so good morning once again. The first one is just to give us an overview of the Expertise France Community Scorecard project. And I want to say that the Community Scorecard is not a project. The Community Scorecard is not a project, it's an initiative. If I say an initiative, what I mean is that it's been integrated into the CHIPS strategy. So right now, the community scorecard is being conducted. So the community-based health planning system is a strategy. And then this community scorecard has been integrated into the CHIP system. So it's being conducted at the community level, even though there are some health centers, and through this project, some hospitals are going to also be conducting the community scorecard. So this is just an overview of the project. So the project is there to help scale up, because ALMA, African Leaders Malaria Alliance, supported Ghana Health Service, or Ghana to, start integrated chip zones in the country. And then now we've gotten funding from Expertise France to scale up this community scorecard into more chip zones. So in 2022, Ghana Health Service and then the partners, which Amren is part, and we have Hope for Future Generation, we have Ghana West African project to combat AIDS and STIs. We also have the School of Public Health, University of Ghana. We also have some other partners came together and wrote a proposal for a grant from the French government through Expertise France 5 initiative. And then the French 5 initiative seeks to strengthen global funds investment, and they are interested in community approaches. That's how come they were very interested in the community scorecard, because it's at the community level. And then the name of this project is Health System Strengthening through Ghana's Community Scorecard, because the scorecard is to strengthen the health system, how community members access healthcare, and then provide feedback so that we, the health workers, will know this project. So we started last year in April. We are in the second year, so I think March this year was the first year ended March this year. So we started the second year. And then we had an amount of approximately 2. So who is involved? So Ghana Health Service is leading, because it's the health. So Ghana Health Service is leading. We have partner organizations like African Leaders Malaria Alliance. We have Hope for Future Generations. We have AMREN, that's African Media and Malaria Research Network. Then we have Christian Health as CHAG facilities, as we call them. Then the West African Project to Combat AIDS and STIs, that's WAPCAS. So these are the partners, and GHS is leading. That's how come you've seen that GHS is here to support AMREN to conduct their activity, which is the training of the journalists. So the overall goal of this project is to strengthen the health system through the scaling up of the Community Scorecard initiative by empowering communities to play an active role in providing feedback and taking actions to improve health service delivery and quality of care. So after this presentation, I'll take you through what the Community Scorecard is. And in short, the Community Scorecard is to empower community members to provide feedback, to give us feedback. How you experience the facility. So you gather and then you just share feedback to the community, the CHMC, and then we also take it. So we have a platform where we see it, and that's the platform that they are setting your accounts on. So you will be able to see what the community members are saying. Then in that, we hope that health authorities and facilities will consider the use of the scorecard patient feedback in decision-making process. It's not fault finding. It's just for us to know how the community wants. So the bad ones are not to say, oh, we are not doing well, we are doing well, but just for us to know that this is how the community members are feeling or the clients are feeling, so that we can also step up in providing the best care or quality of care for them. Then also to institutionalize and promote the community scorecard into decision-making process through capacity building and advocacy at all levels. So as part of this project, Ghana Health Service, we have the national level, we have the regional, we have the districts, the sub-districts, and the community level. So the community level is the first community CHIP zones in communities. So if you are feeling sick or anything, the first point of care is to access the CHIP zone. And where they cannot treat it, then they refer to the higher level. Now go to the polyclinic for primary health care and then be referred, because it's a specialized hospital now. Yeah, so then that's it. So we are also training. Right now we are also going to all the districts to build capacity for the district levels. So as part of the activities, journalists, when you go to the community zone, the communities, they would also have would have known or would have built their capacity on this community scorecard. And you also are going through the same thing, so that when they are conducting their scoring sessions, you know what they are doing. So that's why we are all here. So at the end of this project, or at the end of the 4 years of this project, we hope that regional and district officers and hospital quality managers have the capacity to sustain and strengthen the community scorecard initiative and use it in their decision-making process. Also, that community members trained have the capacity to lead and participate in the community scorecard initiative, consisting of quarterly scoring sessions and the creation of community health action plans. I told you it's a system, levels thing. So we've done regional, about seven regions to finish the capacity building at the district level. Then these regions too are going to cascade it to the community level. So then that's that. Then also women and global fund recipients do the community scorecard and be part of the community action plan. And also highest health authorities are sensitized on the community scorecard. So this we've built the capacity of parliamentarians. The Parliamentary Health Select Committee at Parliament, they're also aware of this, and they also have accounts. So they can also go to the web platform and see whatever is happening in their constituencies and then their communities, and take actions to help them, as we all need funds. Then also health system users are aware of the community scorecard, health directorates who lead the activities and support them. Then you have trainers of trainers for the workshop for district CHIPS coordinators and hospital quality managers, which we are doing. And I said we've done, conducted 9 in 9 regions. And then there's also biannual community scorecard supervision by headquarters. Then before we started all this, we had to develop and finalize training materials, which we are using. Then after the district training, there's going to be training cascaded to community zones, CHIP zones, and then the hospitals. So at the end of the project, we would have trained 1,985 primary health care facilities. That's the CHIP zones, the sub-district, the health centers, and then the district hospital, because that's where the primary health care level starts. So from district, sub-district, and then the community. Then scorecard, peer exchange, and knowledge sharing workshops. So in CHIP zones that are very good or doing, share what you are doing well, how you are undergoing your mobilization, because I kid you not, there are communities that are doing very well with this scorecard. So it all boils down to how the community members are able to mobilize themselves to raise funds for the projects that they want to undertake. Then also improve key population and female participation, and then indicators reporting. So at the hospital level, the idea there is that we have the care that they are receiving, how they are experiencing it. Is it good? Is it bad? So that we can also use that to as tuberculosis scorecards. Then also University of Ghana and other key representatives from public health institutions conduct the community scorecard into the school curriculum, the training institutions, so that at the training institutions they would already have this knowledge, even if it's not graded. Even if it's not graded, at least they will have the idea there, so that when they come out, then they can also be reoriented. Then, so out of that, the curriculum will be developed. Then there's also high-level training with ministers of health and members of parliament, which I said they've been trained and accounts have been given to them. Scorecard field visits by the Minister of Health, and then yes, so then they also went to visit, was an observation tour to see how the scorecard is being done firsthand. You know, they see them, so not that we are reporting to them. So some went to Volta region, some went to Central region, because there are some CHIP zones that are doing very well with the scorecard there. So we took them to those two regions. Then we are saying train journalists on scorecard assessment process across all the 16 regions, which we are having now. Engage media with committee members, and then develop short documentary videos, which is that of Amrin. So what we are doing now is the journalist training. So this is just to go into a little bit of details, as I've mentioned. Yeah. So this so far at the district training, we are supposed to train all 261 districts. So in Eastern region, we've done 9 regions, and that's a total of 168 districts out of 261. So once we complete the 6 other regions, would have completed the 261. And then the district officers that are trained, we invite 3 from each of the districts: the district director, the district health information officer, and the district chief's focal persons, the one who is in charge of the chief's activity in the district. So we invite them, since the community scorecard is integrated into the CHIPS activity. Then also, we also look at some hospitals, because they are also going to be conducting the community scorecard at their level based on the HIV and TB clients. We also invite some selected district hospitals. We don't have funds to train all of them, so we just selected them. And then for the 4 years, we are going to be training 135 district hospitals. So we invite the district hospital quality managers to also join the district training. And then so far we've trained 83 of them. So this on the supervision, which will be conducted every 6 months in a year. Then the training of the CHIP zones. Yes, so then it will be cascaded. So then at the end of the project, every region would have trained about 116 CHIP zones from 23 sub-districts. Yes, and then that's from each training. If I say training, like each gathering like this, just as 3 journalists from each region has been convened here, the participants will be from 5 different CHIP zones. And these 5 different CHIP zones will be from 1 sub-district hospital. Then we would have the CHMC members. I'm sure by now we know who the community health management committees are. Please, do we? We know who they are. Okay, we also know who the community health volunteers, the CHVs, and then who the community health officers are. So the community health officers, they can be a community health nurse, it can be a midwife. Any health worker working at the community level is a community health officer, because the person has been reoriented to work at that level. And then I remember Mr. Divine was taking you through the process that you deployed them, or we place them there, in the sense that we don't just post them that, go to Fanchinoko CHIP zones and go and work there. When you go, you place you there. So you go and report to the district director. The district director would, he or herself will take you there, introduce you to the community leaders, the opinion leaders, and tell them this the life is comfortable there. So then we place them there, or we deploy them to the community. So they are CHOs, and then national will be there to support the training. District will be there to support. Will be there to facilitate this training. So this training will be primarily done by the district officers. That's how come we are training them. So it's a system. First we train the regional level, national trained and regional level. Then now at the district level, the regions are the ones doing the training. And then at the CHIPS level, the district levels will do it. But then they will have reps, support from the various levels. So if the CHIPS zone, even though the district level is the one going to do the training, there'll be support from the region, and then there'll be support from national. So that's whatever. So then it's also going to follow the same training, 2 days, just as we are doing here. And then they'll have role play sessions, which when time permits, would also conduct, so that you have a feel of how the committee scorecard is conducted at the committee level. So then there's also going to be training. So at the district level, they have hospital, how do you call them? District health committees, and then hospital advisory groups. Yeah, so they are the ones going to be forming the CHIPS, the community health. Are we safe? Because it seems something is smelling like it's burning. You are safe. Okay. So there are going to be 2 trainings at the. There are going to be 2 trainings. And then okay, you are safe. Okay. So then, wow, so strong.
Explain to them what it is.
Yes,
because everybody is standing around. Yeah, one of the tea machines there had dried up, and the fire was still on. The power was still on, so it's off. We are safe now.
Thank you. Okay, so 135 from each of the district hospitals, one on Ghana, Christian Health Association of Ghana would be in charge of this particular training, because they are the ones that have direct contact with these clients, HIV and that's just an overview of the project. What the expertise funds is supporting Ghana Health Service and then its partners to do based on the committee scorecard. So then, without further, I'll just go straight into what the committee scorecard is. We've been hearing committee scorecard, committee scorecard. What is it? So now we are just going straight into it. So before that, why this training? So the main goal of this training is to empower journalists with the knowledge and skills to access, interpret, and utilize data from the Ghana Community Scorecard. And why are we saying this? So that you can report how you drive, create awareness, advocate, and then also for accountability sake. So the main idea is that you would also understand what we are doing as a health system, so that when you are reporting, you can report effectively, understanding of what the CHIPS concept is all about. I'm sure you've been hearing it, but today, those of us here, we've got clear understanding of what the CHIPS compound is. And going forward, when we are writing what CHIPS is, we are not going to write CHIPS, CHIP, because we see that a lot. I'll be watching the news and then they're written CHIP. Yes, oh. And it's not your fault. CHIPS is CHIPS. The health facility CHIPS is CHPS. Community-based health planning and service, and then of the community scorecard process. So we are going to take you through how the community scorecard is conducted. There are 2 different components: the quarterly scoring sessions and then the action development. So there are 2 main components. We are going to, so that you understand the community scorecard process from the data collection to the action plan development to enable informed and accurate reporting. Also, to train journalists on how to access and interpret community scorecard data. That's why we are creating the web platform account for you, so that when you go onto the web platform and you see the colors, you see red, you know what it means. You see yellow, you know what it means. You see green, you know what it means. Then also that journalists will use the data for advocacy by highlighting health system challenges and successes and promoting accountability. Then also enabling them to gather first-hand insights for in-depth reporting. Because you are going to be helping us a lot. And Dr. Binka mentioned that Amrin shared with me a newsletter, which is also one form of communication. So I'm going to take the soft copy and go and put it on our website. We are also going to distribute it to our partners that we are really doing the work. Then also that we'll leverage on the media to enhance public awareness and discourse on health system improvement, community feedback, and community scorecard outcomes. So there are a lot of things that communities are doing based from this community scorecard. So we want the journalists to project that so that other people will hear it and be like, hey, these people, they're also doing this. So then let us also sit down and see how we can also match up with the best. Because there are a lot of communities that even I've gone on monitoring. I think it was Central for a very long time. They don't want her to leave because when you go there, how she will receive you. Like, we've all been patient before, and you'll bear with me that there are instances that we meet a nurse and then she's very, rude to us, and we don't even want to go there. And there are instances that you go there, the way the nurse would even talk to you, you will even forget which part of your body is even hurting. And through that, the community members have built, when she went there, there was no maternity ward. And through their own contribution, they built a very big maternity ward. And they said it's because of her that they built it. So they are not going to allow her to leave. You see, she's been there for a very long time. She even wants to leave. But they said no. The way when you go there, she will receive, even comes home to your home. If she sees that you stretch your arm, let me do the check your BP and all that. She would have a chat with you. So those are some of the things that you would project these things for us. Then this is just like how the scorecard web platform will look. Later you would be taken through the web platform, but then when you log into the web platform, I don't know if anyone here has logged into the web platform. When you log into the web platform, you see colors. And then 63, there's 67, and then in that too, there are arrows. So there are three things. There are colors, there are values, and then there are arrows. And each of that means something. But then when you open the web platform, this is what you see. So now we are going into what the community scorecard is. The definitions and discussion points that is used for the scoring session. Then how they conduct the scoring session. And then how they also community scorecard. Just as the name suggests, community. It's community-led. And if I say community-led, it's led by the CHMC. CHMC, Community Health Management Committee. And every CHIP zone is supposed to have a CHMC. Every CHIP zone is supposed to have a CHMC. You're supposed to have a community health volunteer, a CHO, to support, and those are the community structures. You, the CHO that you are posted there, the CHV from your own, the community themselves, and they are selected. So the CHVs, those are the volunteers. They are the ones that support the CHO in conducting some of the activities, so they can help in immunization. If they go into the community and they see anything, they will refer them that, oh, come to the CHIP zone, so that the CHO would attend to you. So they live there, and then in terms of language barrier, if the CHO doesn't understand the language of the community, the CHV will be able to support that. And then the CHMC, just as Mr. Divine mentioned, they are supposed to be made up of very prominent and respectable people of the community. So some of them, they themselves are part of the committee. Some too, they have reps on the committee that report to them. So it's community led. That's number one. And then it's to promote accountability. If we say to promote time, we'll just be providing services. But then we also want to hear from the community side that, oh, this service that you are providing for us, this is how we feel about it. And through that, we put them in grades, and then we have indicators that they look at. And then local government structures, as I mentioned, local government structures, the CHMC, and the community to promote that, and then they do the scoring session. So the community scorecard captures community perception on how they experience healthcare delivery at the facility. Perception. So this quarter, I can go to the facility and the person is very nice to me. So while people are complaining, I am happy that, oh, this person has been nice to me, because we didn't have the same experience. Another month, I can go and it may not be, or even maybe the same health worker. But who knows? We are human beings. We have feelings. So she may have experienced whatever. And I went there and she's very rude to me. That quarter, when I'm scoring, I'll score her that, oh, she wasn't nice to me, based on the indicator. So it's based on perception, and it's not false finding. Then create a mechanism for stakeholders to monitor service quality and respond to community needs. So through that, they come up with that they want to help solve, then they do that. And then for monitoring, anyone like you that you have accounts now can be able to also see what is happening every quarter, how each region is faring, how the national is faring, how sub-districts are faring, regions, and even facilities, because you can drill down in the web platform to see how the facilities are doing, and even that the actions that they plan to use to improve their community, you can also see them, and then the status. So it provides a tool for community health workers and community members to understand and relay community needs and perceptions. It also reinforces accountability of primary health care facilities and community health officers to community. So when we look on the platform and then we see that, hey, our community, they say one of the indicators is caring, respectful, compassionate care. And we see that that is dropping. What it tells us at the headquarters is that our health workers are not, their attitudes are bad because the people are complaining. Then on our level, we can also take actions to improve the attitude of the we also take actions to do that together with community members as well. So that's what the community scorecard is. And then, so the whole community scorecard started in January 2018. I mentioned that Alma together with GHS developed the community scorecard. And then the community scorecard allows community members to take score health facilities on 9 indicators and then take actions to fix the 9 indicators. They take actions to resolve the scores that are low, the least scores, because the idea is to improve. So there are three values: 1 for good, 2 for average, 3. If you have 1, then we know that is bad. Then you take actions to solve it. So if they are out of the 9 indicators, they are about 2 that were scored 1, 2. Then you focus on those ones to help to solve those problems at that level. So it also provides GHS and other stakeholders with insights into where support should be targeted. Just as I said, when you look at the web platform, you know, oh, okay, this is where people are really complaining. They don't have medicines, they don't have this diagnostics, they don't have this, they don't have that. Then we also come in to support, or we, together with the communities, we support them. Then, so currently Ghana has 4 scorecards, and the community scorecard is one of them. So we reproductive, maternal, newborn, child, adolescent health, RAMCA. So there's a scorecard on that. We also have one on malaria. we also have been given, you'll be able to access all these scorecards by just a click. When you click on malaria, you go into it, you look at the indicators. And there are some selected indicators, prioritized indicators that the nation looks at. So those are the ones that are on priorities from the National Strategic Plan and are more of the supply side of healthcare. If you say supply side, it's only the community scorecard that looks at the demand side. And when I say demand, that looks at the perspective from the community. The communities are the ones telling us. But then if you say supply side, the communities, they don't engage with the communities. The services that are provided, they enter into the system. We have a system where they enter all those data. So it's called the DIMS. That's the District Health Information Ratio, anemia, all those things. They are the services that are provided. So it's pushed, C4 visit, and all that. So when you open it, this is how it comes. The regions are there. The national is at the top, that's Ghana. Then you have the 16 regions, and you have the indicators on the at the columns, in the columns. Yeah. So you have indicators for the RAMCA, you have indicators on reproductive, maternal, newborn, child, and then so forth. Then there's also the nutrition scorecard, and then we have the community scorecard, which that's why we are here. We are here for the community scorecard. Then the community scorecard collects data based on community feedback on 9 quality of care indicators. Data from DIMS2 is used to automatically produce the scorecards every quarter. What we mean by this is that when the scores sit down physically to give scores to the indicators, it's entered into our DIMS platform. And on the DIMS platform, the health information management platform, it's not everyone that has access to it. So like the district health information officer and some other people that have access to it, they enter these scores, the 2, 3, 1 values, they enter it into the DIMS, and then every month it's pushed into the web platform, into the scorecard web platform. And it's on the web platform that we give access to people to also see. Then the country is currently developing other scorecards, HIV and TB, as I mentioned earlier. So it's, let me say, 90% completed. I'm sure it would go live soon. Then, so the community scorecard is integrated into the CHIP strategy. And then the community scorecard is convened quarterly. There are quarterly meetings. So once every quarter, they meet in development session. So there are 2 components. The scoring session to vote on 9 indicators related to quality of services in their community, and then creation of health system gaps. So you see in the picture, the 2 pictures there, a session of communities that have gathered to do the scoring. So as they raise their hands, it means they are voting on some indicator that they are discussing at that moment. So for each qualitative indicator is assigned a value. So the scores receive a majority vote and it's recorded. If I say majority vote, we've gathered here. Then when I mention, after we've discussed what the indicator means, when I mention, okay, those of us who think we should give this indicator 1, we all raise our hands and I count. Okay, 10 people from here said we'll give this particular indicator. Those who think we should give 2, I count, 5. Then those of us who think they are doing well, that's 3. So then I put there maybe 20. So it means that based on the simple majority, we'll record the value 3. Even though someone says it's bad, the majority of us is saying that it's good. So we record the simple majority. Then communities develop community health action plans based on the scores. So based into your groups and then think of reasons for each value that you give. If you give 3, why do you think you are giving 3? Maybe availability, accessibility, and quality of health services and infrastructure is 1. Maybe the place or the CHIP zone, the facility is not visible because there is bush around. So then it means that you are coming together to maybe weed the bush around the facility, or there's no signboard, so you want to put a signboard to it. If the facility is not clean, you find maybe there's no bin around. So you try to get a bin. If there's no incinerator, you try to put an incinerator, or even no urinal. You go to some chip zones and then there's no urinal. So then the scores and action plans are recorded on paper, posted in key areas of the community, then shared with a government health management information system officer responsible for data entry into them. So the 9 indicators, these are the 9 indicators: caring, respectful and compassionate care, waiting time for service provision, availability of medicines, diagnostic services and supplies, availability, accessibility and quality of health services and infrastructure. There's cleanliness and safety of the facility. There's leadership and management of the facility. There's conducting of home visits by health staff. There's also conducting of home visits by the community health volunteer. And then there's also assessment of the NHIA services. So we'll go into detail. We'll take each indicator and then look at it and how it's done. And respectful, compassionate care. Can anyone help me? We've all been patients or clients at the facility. So here we want to know whether the health worker has empathy for us, listens to our concerns, is kind, is respectful towards us. So the indicator: person-centered care with respect and empathy, effective communication with clients and families, respect for patient and family participation in decision making, decisions and care. Not that when you go there, sit here, go there. And we've all witnessed that before. They happen. So that's one indicator. We want to know whether the health workers are caring. And I've come to the facility, I'm already vulnerable. The least thing, I'll just be crying. Because I'm in a state that I'm not happy. Things. I've been, I already had heard that, hey, this school nurse, dear, she's like this, so she's like this. But I had malaria, I couldn't help it. So I went to the sick bay. Just standing there, as if I should just vanish. I said at that moment, my sickness was gone. Because even on the chair, I don't even think I sat there. I was just sitting on the corner. Because, like, I even started. Nobody is pampering you. You're on your own. And when I've come to shout at me. But then, pardon? If I say pamp, I'm not saying they should put food in your mouth and all those things. But then the way they'll talk to you, you will feel okay. There are some people that the way they talk to you would make you feel that, oh, at least you are also needed there. That's why we say it's perception. No, so it's quarterly. So if that quarter you went there and you had this experience, because the scores are quarterly. It's not that my complete perception about you that you dear, you are bad. If I hadn't gone there and they had asked me, I would have scored her 1 because that's what I've heard. But me going to experience it that phase, then she shouted at me. I'll score her bad. But the next time when I went, she was nice. I'll score her 3 because she's nice to me. Is there? No, I'm saying that the first experience, I'll score her bad because that was the encounter. But then when I went the second time, she even prepared tea for me. She said, oh, how are you? She even gave me the medicine to take. Oh, take the tea. Oh, sit here. Are you okay? Would you go to the classroom? Oh, my goodness. I was thinking, this is the same. And when I was going, in fact, I was even scared because my first experience, I was like guarded. So when I got there, I greeted her and I sat down. Because I don't want to be standing for you to shout again that I should sit down. So I greeted and I sat down. So what's wrong with you? I said, oh, I'm not feeling well. Like I'm having a headache, my body. It's like, oh, have you eaten? Explain things to me. So I will ask her. No, that happens. That happens. Sometimes, but then should that be the norm? Should they write on my forehead, I'm a president, before someone? Should they write on my forehead that I'm the president? I always say that this country that we are in, it's a ripple effect. Look at what happened to what's his name, the vice president, Mr. Art. They say it's not true. They said what, pick up whatever. But then it's a ripple effect. I always say that these So I'm saying that this health system that we are all in, you think that because you are in a higher position, when like some things are beyond you. But mind you, I can go to a cheap zone, just going for my normal work, and at that moment I'm feeling sick. But if that place is the best, they'll be able to give me first aid to make me feel well before if I need to be referred. But imagine if that place there's nothing there. On the way something happens. But I always say that we need to make sure that our area is the best. Facility, the health service in our area is the best. You can go there and then you are just feeling feverish and you need care. If there's community health nurse or the CHO present that will take care of you. So we are saying that coming back to caring, respectful, compassionate care, our nurses need to be a little bit more compassionate. Because the moment the person health system a lot, because it will show whether the patients trust you. You think if I had another option, I would have gone to this sick bay again. I won't go. I don't think I even went early. I'm still like there's nothing I can do. So let me put shame aside and whatever aside and go. I don't know. Did the health worker pay attention to your concerns? So those are the actions, then they'll think about it as a group, and then they vote. And then they vote. So then the number two, we are talking about waiting time. So the time that you got to the facility, and the time that care to you. That is a genuine concern. If within 5 minutes I need to even get up and go and stretch my leg or go and buy water or go to the urinal, I can do that. But me sitting there in queue, not knowing whether the doctor or the nurse is there, Even when I am even pressed to unit, I'll be sitting there because I don't know when they will come calling the people, and I'll be missed. So the waiting time refers to the time the patient are due to receive care. If yes, did you feel that the wait was unnecessary or unjustified? You believe in effective communication. You need to talk to the people.
No, by the time
Oh, there's someone who has come emergency, so please give us 10 minutes, give us 30 minutes. Even if you tell the person, give me 1 hour, the person will give you because you've asked for it. But that same 1 hour, if you don't tell the person what is wrong, we'll all be there, we'll be jittery. Hey, what are they doing there? What are they? But they are doing something genuine there. So we're expecting that when you went there and you took the time that you received care was long, did they actually come to talk to you? Was it? Those are the things that you want to know. Why the book? Oh. No. So the health worker is not present at all. That's why it's just the community members that are there to do the voting. You, the health worker, you will just leave and go and sit at another place. There seems to be. So availability of medicines, diagnostic services, and supplies. Whether the diagnostic services are available, if it's at the CHIPS level, whether you have your malaria test, I don't know how they call them, but then whether I have your malaria test, whether I have to take my BP, and I come there and you're now hitting your BP. Even with the figure that you give me, I will not even believe it. So those are some of the instances. So sometimes you go there, when they have the scoring, they say, when I went there, the person was beating the apparatus. So to her, she feels that the apparatus is not working well and may not give her the right numbers or figures. So did you receive all your prescribed medicines from the health center? Do you and your relatives also receive all your prescribed medicines from the health center and all that? So then they discuss this, understand the indicators. Then availability, accessibility, and quality of health services and infrastructure. So we want to know whether the health facility is available or the services are available, whether the facility is easy to access, and then whether the services being provided are of quality. And then in terms of infrastructure, whether there is any other infrastructure that the community need that is not there. And not, if you say infrastructure, not only health service infrastructure, urinal, incinerator, all those things. Because you need an incinerator to dispose of placenta and all those things. That level. Then services are easy to access with respect to geographic proximity and cost. The health facility has adequate infrastructure such as toilets, hand washing, bath facility, incinerators, etc. Then quality of services in terms of receiving the right treatment and having appropriate medical staff is available. So are these services available? Are the services easy to access? Does the health facility have these infrastructure, toilets, hand washing, incinerators, all those? So then after that, they discuss the particular indicator and then they vote. So in terms of leadership and management of the facility, the CHO is in charge, the leader, and then manages the facility. So we want to know whether the leadership of the facility is responsive to community needs. When community come there to report to them, and then do the leaders respond promptly to grievances and attempt to address these issues? So those are some of the discussion points, and the votes on them. Then also cleanliness and safety of the facility. That the facility is clean and safe in delivering health services. That you don't go there and you find a strange, not appropriately disposed of. There's this tissue, blood on the floor. This gloves is hanging somewhere, and all that. And is there running water and toilet facility? Even if there is no tap, at least there should be some sort of water available. Is there regular supply? Is there the presence of a security personnel? All those things. Yes, you need a security. You need a security. And is the community members are supposed to at least provide you one. Yes. So, conduct of home visits by health staff. That's the CHN or the midwife or the CHO. So, whether the health staff, how is your experience with the home visits? When they come, what do? Do they take your BP? Do they talk to you? Or they are always in a hurry? Or they don't even come at all, but then they go and sit under a tree and they'll just be writing the things. We also want to know that. Then, same for the community health volunteer. So, your experience interacting with the community health volunteers, do you see them in your communities? How often do you see them? Then, assessment of NHI services. So, there are some of the services that are covered by NHI, likewise the health center. So, the higher you go, then the broader the scope of services that are under the NHI. So whether the health facilities accept the NHI cards and patients are able to access medicines during NHI using the NHIs. So then they discuss that and then they vote. So this, how the scoring form is. So we then the total score is given. Then the total score is given. Then the compiled by the CHMC chair, secretary or whoever has been designated. Then it's endorsed by the CHMC, the chair, the CHMC chair endorses it and sign. So there's the form. So the committee scorecard quarterly process. So it starts by the CHMC or communities conducting a tour of the facility to understand the conditions of the infrastructure, commodity availability, and equipment of the facility. So it's more of like a facility assessment. Then after that, the committee led by the CHMC conduct scoring sessions by voting on the 9 indicators. The scores that receive the majority vote is recorded in the scorecard. That's the Form A. Then after that, the committees develop community health action plans to address problems identified in the scoring session. Progress of action plans from the previous quarters are reviewed. So if this quarter you met and then you develop action plans, the next quarter when you are meeting, you have to review whether the previous actions have been resolved. If they've not been resolved, you have to carry them forward and then add to it. Then meetings, and most of the time, so during the scoring session, what is done is that there's no health worker present. But then after they've developed the actions and they've scored the indicators of the facility, now they can bring the CHO, that's the health worker, together. Then they can find ways and means to resolve whatever actions or problems that present results, and the steps outlined to resolve the gaps within a period of 3 months. So after the scoring, now you say, oh, maybe the health workers can come. Then when they come, the committee chair will now tell them that, oh, they did the scoring and these. So share scores with district CHIPS coordinators to enter scores into the DIMS and action plans in the scorecard web platform to produce color-coded scorecards and provide online access to many stakeholders. So there are some, if there are computer savvy members in the committee, the CHMC, they also have access to the web platform so that they can see how they are performing, their particular committee or CHIP zone is performing. Then also government and partners can use the ramp to understand bottlenecks based on community feedback. This community feedback can be used to inform action. So as I said earlier, it's not fault finding. It's just for us to know what the community members are thinking of the services that are being rendered to them. So for the preparatory phase, that's like a week before the assessment, the CHO would orient the CHMCs on the scorecard process and agree on a date. So if this is the first time they are going to do it, just to reorient them, refresh their mind on how it's done, you just orient them, the CHO will just orient them, and they agree on a date. Then they'll brief the sub-district and the district about the time and date and venue for the assessments, so that they'll all be present when it's time. Then they ensure that the CHMC has all materials, including pens, copies of the scoring forms, copies of the previous quarter action form, the new action planning form, and then a folder. This is my clear bag, so that they can just store it in it. And we said 3 because you keep one at the facility. The CHMC chair can also keep one, and the one is also sent to the sub-district. Then the CHMC and committee members should take a tour of the facility before the scoring assessment. This will give CHMCs an idea of the existing structure, infrastructure, equipment, and commodity availability, a tour inside and outside, so that they know, they have an idea. But then I always say that you as a CHMC, you are supposed to be there, like you're supposed to oversee the work that the CHO is doing, because you are in the community with the zone, the compound. As for the CHO, she is just being posted there. She will leave and another person will come. So you have to make sure that the right things are being done. So it's more of like the board of directors of the CHIPS compound. So if you, a CHMC, is during that time that maybe you are coming to be touring to know, then it means that you are not very active then. But if you are active and on top of your... So meeting conditions. We are saying that the CHMC chair or another appointee to lead the scoring and action planning discussions, and a secretary should be appointed to keep records of all decisions on the form. So the chairperson will be leading it. Once I'm talking, there's someone who is putting the scores down. Then a minimum of 15 participants is adequate. 50% should be female, 50% should be male. All things being equal. Why are we saying that 50% should be female? Anyone? Why are we health facility? The listing their children, we think the female will be in a better position to give you. And then also the females, even when you invite them, they don't even talk. But here we are saying that it's just for our good. It's not fault finding. You won't go and say that this person has respected me, and somebody amongst you will go and tell them. It's not. I've never even heard it that somebody amongst the community went to say that, hey, mommy, we're instinct to mumbuadi. I've never even heard it. Because it's for your own good. You think tomorrow, do you know what will happen to you? So we are all even idle, so they do come. But we also want the females to participate. And if possible, there should be people from also and leave. Don't want any bias. Don't want any bias. So before that, the CHMC chair or facilitator and participants will introduce themselves. And then attendance is recorded on the Form A. The CHMC chair reassures participants that the scoring is conducted only to get community feedback on health services, and their honest feedback facilities during this quarter. Don't carry forward anything in the next quarter. When you went to the facility today or this quarter, how was the services like? So then you give us what your experience was in that particular quarter. So it's quarterly. That's why we are doing it quarterly. So it's quarterly. That's why we are doing it quarterly. Then participants who do not want to answer or have no experience with the health facility, or have other reasons not to participate, will be considered as neutral. So if you are calling the committee members and someone says, I don't want to partake, you don't have to force the person. Even if the person comes and there's a particular indicator that person doesn't want to vote, you don't force the person to vote. You count the person. Yeah, so then you call them and then they gather like this, and then yeah. Yeah, so then the CHMC here, I'll explain an indicator to you, and then I ask you, okay, so how many of us want to give one? Then amongst you, just raise your hand, and then the number will be recorded. So, okay. So then, before that, the facilitator will present the objectives. Why the gathering of committee members to conduct this scoring process? That's plans to address the priority issues for the quarter, provide regular feedback to government and partners on health services so they can provide support where necessary, then strengthen accountability and transparency in the health system. So sometimes this scoring, when we open the web platform, we also use it for advocacy. There are times that partners want to support in a thing. So then it's there for everybody to see. Not that we are cooking something to come and tell them. We open the platform, they are there. Then even some of these development partners even have access to the website, the web platform. So they also see whatever is happening there. So the scoring process. So you explain to participants that they will discuss 9 indicators to understand their experiences with healthcare services at their facility or hospital. Each indicator will receive a score, 3 being good. Then using the table 1, that's like the table that is in the user guide. The table 1 to guide your discussion for 5 to 10 minutes on each indicator. Then community member indicator to you, how many of us think that, okay, now that we've understood this particular indicator, caring, respectful, compassion, I mark it. I write it aside. How many of you think 2? 10 people raise their hands, I put 2. How many of you think 3, that they are good? 10 people or 12 people raise their hands and say they are good. So out of these things that I've written, the one with the majority, meaning that 12 people said good. So it's the number 3 that we put on the sheet. And so then the facilitator records the score that receives simple majority in Form A. If a score receives equal votes, the lower score should be recorded unless a consensus is reached. So that is to say that if on a particular indicator, 10 people say bad, 10 people say good, we will record the bad, but then the issue is still there. So if 10 people said 1 and 10 people said 2, we'll record 1. If 10 people said 2, 10 people said. So this is how it comes. So you realize that Ghana, that's how the national figure. So it's an aggregate of all the regions. So Ghana, I think caring, respectful, compassionate care, you have 97. Red for some. Green values, if you know, there's an algorithm in the system. So even though in the information system they enter, so all this you are still use more than 100 because of what is entered. So this 97 here is 97%. And between 70 and 95, no, 96, 95. Then red is below 75, and the yellows are between, you find 95 as yellow, you find 69, 71 or 70 as yellow. So those are the thresholds. And then the arrows, up and down arrows, are just showing the progress from the previous quarter. If you find an upward arrow, it means that they've done better from the previous quarter. Maybe, let's say Ghana, the availability, accessibility is 83, yellow, and there's an upward maybe in the previous quarter it may have been red, or even this is 83, maybe it was even 80%. So it means that in the previous quarter you've even done better. If the arrow is downward, it means that you've even done worse than the previous quarter. Meaning that in the previous quarter you had a higher value, but then you've gotten a lower value this quarter. If there's no figure at all, it means you've just maintained the figures. More will be said in their scores and all that. Now they will gather and then develop action plans. So there's also the form for the action plans, the region, district, sub-district, name of the facilities. So there are 3 slots. So then you put the problem, the action that have been identified, the stakeholders or collaborators, who is responsible. When we are coming to follow up on that particular action, who are we coming to call to give us updates on the action? Then the deadline. Then the chairperson will sign, phone number. Secretary would sign or put the name and then phone number. The action plan, all answers should be recorded by the secretary. We don't want, even though the health worker will be present, we don't want them writing your thing for you. We want they themselves to write it. So the CHMC or the same secretary that was recording the scores will be the same secretary that would write the actions. Then the action plan should be developed during an interface meeting convening the CHO or facility head, the CHMC, the committee members, and other interested groups such as the CSOs. So the facilitator begins by and develop new actions to address the gaps for the present quarter. Then review that needs to happen to achieve pending actions. So he said, do this step before developing new actions. It's very important because if you should open the action plan, the web platform, the action tracker for you, you will see that there are a lot of actions and they didn't update it in the system. Before you develop new actions, make sure that you review the old actions and then change the status in the action tracker. Then next, the CHMC chair should summarize the results of the quarter scoring session scores. Then the scores, the indicators that had the least scores, that's why you prioritize so that you develop actions on them. Then it should be participatory between the committee and the health service. Not that health service is coming to tell you what to do. We are all brainstorming. We are finding solutions or causes of the problem. Participatory dialogue between the committee members and then the health workers. Then create a new action plan for the current quarter using the Form B, what I showed you. And a minimum of 3 action items should be developed for the CHMC to manage within the quarter. We don't want them, we even want a maximum of 3. Then the CHO or facility head should only guide the committee members to develop the action plans, but should not write the issues and solutions for them. So that they go accusing you that you went to write something that you are not supposed to write. So allow them write their thing. You guide them. They need to construct the sentence. Then the CHMC chairperson reminds participants the CHMC process will be conducted every quarter, every 3 months. Then the CHMC chair thanks the committee members, and that's that. So there are 3 steps in creating the actions. You prioritize the least scored indicators. You investigate them. You say investigate them. You find the causes. This is existing, so that once you find solution to it, it will not repeat again. Then you act by developing action plans to it. Specific. They should follow this procedure. The actions are specific and describe a process. Ensure there are no stockouts. What does it mean? Stockout of what? Write a letter to sub-district leader to inform them of their constant stockouts of antibiotics at the health facility and request assistance. So if you write this, and me from National, I come and I'm looking through your book and I see this. The first question I'll ask, not that you write, ensure there are no stockouts. I don't even know stockouts of what, who is doing what. So if the CHO is writing a letter, I know that it's a letter that is going to the sub-district. Did you write the letter? You, the CHO, did you write the letter? Oh, yes, I wrote the letter. I took it to the sub-district head. And what did they? You know, there's a channel to it. But if you write the ensure there are no stockouts, it doesn't say anything. and that the owner is capable of implementing the action. You don't go building castles in the air. That's, for instance, the CHMC to meet the president of Ghana. Meanwhile, committee member that will come all the way to Accra that you are coming to meet the president when you've not even gone to your local authorities. So you want that to deal with your local authorities first. So the CHMC, is this not very clear? Hello? Is this action not very clear? If I come, I'll even ask, okay, so you're supposed to raise 10,000. How much do you have? Oh, we were able to raise 2,000. Maybe I have some small. Oh, it will be president matter. But if you put it this way, when I come, oh, how much have you raised? I even know what you want to use it. If you're able to meet the traditional leaders, oh, we met them. We were able to do some fundraising. How much did you get? Oh, about 5,000. Oh, okay, maybe I can also support 1,000 Ghana cedi. When another person comes, they will support you, support you, support you. At the end of the day, you will get your amount and you start your war. That you develop an action and say that improve home visits. Is it clear? It's not clear. The best is that sub-districting home visits in 1 month. Then here you know that the problem with home visits is not even with the CHO. It's the CHVs that are not even doing the home visits. And then even when I come, I'll ask, okay, I'll ask the sub-district leader if they've had the discussion or they've reoriented them on the importance of home visits. Oh yes. Have they started? Oh yes. How many have they done so far? Oh, they've done 20. There's progress. Then it should be responsive. That you don't say sensitive community members on the important sensitization meeting. So you know that you want to put together or gather at least 100 community members. Maybe measles is very rampant in the community, so you want to polio. Right now they are having we are coming to give polio. You need to let them know and give about coffee bra. Then not that you are now going to introduce yourself and talk then they'll say, oh, that be coffee crown you. So these are the ways that we want them to develop the actions so that they will be very effective. So after everything has been done, scoring has been done, action plans have been developed, and then a copy will be kept by the CHMC chair, another one at the facility, then another one will be another one at the facility, another one will go to the thing that we should be made. If you want to give your sub-district some, you will give them. Then the CHO or the facility head will enter the action plans into the scorecard web. If amongst the CHMC there's a computer guru amongst them, well, he has access. So he can also enter these actions in the action tracker. But if they are not computer literate, they can just sit with the CHO and be available on the website. So we have a website, www.rmncah.org. So we start and then also access it. So these are some of the actions that the community scorecard has helped to donated land for new health facilities. They've even built new health facilities. They've financed improvements of existing health facilities. They've resolved water supply by, there's the poly tank. There's also community advocacy to mobilize resources for governments to buy equipment, local solutions to drug stockouts. They volunteered time at the facility to clean on behalf of the community to higher levels. They've established maternity waiting rooms. They've purchased generators, and then they've improved availability. I think the man, he's a CHMC. I think he's even the chairperson. And he had lived in Accra, but now he's retired and decided to go to his village. So now he is now the managing affairs, the chairman of the committee. So he calls on the down, and then they render accounts. So it's not like you are paying and then somebody is shopping. So they render, that is like a well thought of system. So you gather the money. This is how much we got from our small fundraising. So they don't wait that at the end. Oh, today we had 100 cedis. then they'll go and put this in account. If at the end of the quarter, then they'll come and render account. Or the other time we put at the quarter. So when they need to do something, they just go and take some, and then I'll go and then gather from the community. Because if you are going to ask money from, if I come, even if the thing is 10,000, oh, I got 1,000, I also help you because you are making the effort. But you don't come with empty hand and say that we are coming to collect money from me. So these are just a few of the things that people are doing. I've been witness to, like, you know, a lot of activities that they are doing, especially in Volta, in Central, where they for the field visits. We took them to Volta in Central region. The community members that even came, oh, that day was marvelous. They danced, they did bobo, it was a sight. After that, when they were even dancing, people were giving money. We also went to give money. We were all happy. And we even forgot that we came there for a purpose. So we also gave money. It's when you have ways that they can extort money. Some too, they are waiting for who? We are all there buying, so we need to help ourselves. So this is the action tracker. This is how it looks like. So you would have the date that it was created, the deadline, the status, the explanation, the problem, that's the bottleneck, and the action description. Whatever you are doing to solve it. So this is just an example of a community that wrote this. That was 2018 when it was started. So there are names, then there's a shortage of medicine and inadequate enhanced. We see nurses don't respect and sometimes lock the center doors, the chip zone doors, and keep the keys. Chip zones that I've been to, they have this, I don't know what they call them, but then it's like a clock, itinerary something. So they've written the places that they should be. They just put it at the door and then they tilt the arm to where they are. So when I come and then I see that, oh, maybe you are home, I know you are home. When I come and then you are those things. So this is that. We know how it's done. So if you go somewhere and we see a community doing it, we know that, oh, they are conducting scoring session. And then the indicators, we understand. If they show us the scoring platform, we know what the values mean. Sure. I think was the answer.
So my point was that you said the health worker would be asked to leave the place so that she doesn't interfere in it.
So one-on-one, we are all voting. But then the thing is, I've never heard that one. But also, I don't think we even mind that you go and tell her. Oh, to avoid bias, so that intimidation, so that people will not be free to express themselves. Yes, because sometimes when she's there, people want to say something, but then they will be hesitant. But to avoid bias, so that people will be free to express themselves however they are. If after I've said it, that is my experience, go and tell her. And even one-on-one, sometimes you have 100 people finish the whole day. Because people want to even come and do this thing quickly and then go back and do their work.
Wouldn't say the exact thing that I wanted to, irrespective of the fact that fine, I don't care, I will say it. There could also be another argument that
who is saying that she's not respectful. You may have 10, so are you going to say 10 people said you don't respect? That should even, if you come and tell me that 10 people said, it's something that I should even be a start disrespectful. Me as a person, personally, I should have a reflective, what am I doing? And then during the action development, when you come, they even tell you this, that, oh, we we scored 1 because the majority of the people say that, but they are not going to mention, do you have anything to say? Maybe when you're reflecting, you realize that, oh, maybe you remember that one particular day you were not really well, you had something. We are free to say it there. But then whatever we've done stands. The thing is that the district will come and talk to you. You also explain your side of the story to them. I'm hoping that you would improve. Because there are instances that they will not even come. A lot of people from coming to the facilities, they will transfer you to another place. And there are places that the CHMC take it on them. Because you cannot come, the CHMCs have power. They deal with them. The same way they can say, oh, I will not let this person go because she's like this, she's like this. The same way it's simple. And then the action is taken.
Compound or a zone. These are the indicators. So if I go to that particular chip compound that I'm talking about and I want to assess them, would I request these things that they have done from them, or I can find them on the platform that, of course, you have created?
Scorecard is one. Not that you are going to assess them, but then as part, I said earlier on that the AMREN is the visibility part of the. So in writing your stories, if you don't understand, how do you write your story? So you also need to understand when you go and then they be able to write a story out of it. When they tell you that, oh, they've had so and so from the committee scorecard, you know that this is the process that they took to get whatever they got. So it's just for you to also have an understanding so that when you go and then they are also having, because during the cascading, they are going to, you saw them and then you even go and stand there and then just listen 1 or 2 and you know, oh, okay, this is what they are doing. You can even stand there to watch. You are just a neutral person happening. Yeah.
Please, my question maybe Sana say feedback BII 10-year health insurance. Because so me call and me kuta insurance, but ya me and I say para cry trauma me say me nkoto. So because chief compounder be the right way. I be a health officer na say nipa na wono be catch a patient na say bia. Yare we see na chief compound no. You know say your zones, but then no moshe ansana or more afa specific location no my population and answer land sites and or he know to me no betting ya pray the banochrome. I want to know.
He wants it to be accessible to everybody. So the idea is that it should be at a point that everybody can come to. But then there are
everyone so I like we say there are people be almost isolated because so different because police for any baby police for a distance almost see police stations near there. Into we say no so
you center it in the middle, at least it should be closer to, not that it will be too far. I won't be in where should I say Kolebu, and maybe if I'm in Kolebu, I should have access to that. You walk. Then you say, oh, you casually walk 5 minutes and go. But then it shouldn't be too far to put strain on the client. So we make sure that if it's government that is building it, we make sure that we put it at a place that it's accessible to everybody, like at a mid. So that one, most of the time, we say that as part of the community engagement, there is community deba. So as a CHO, together with your CHV and your someone comes and this is not a medicine is not under the NHIS. It's communication. Oh, do we are trauma we say what anytime talk and we introduce but we say it was all koto. Say so the person will know that. But then to just write it and I'm not aware community first, they know that oh one day they will even go and buy. Yes. So,
health insurance no like but nipa no needs kenti no so de ye ne sa ma me but baby echi na ya charge no say wontu ya because sa complaints ni be nyame ko e no ya gi mi
please so let's get the concept clear. CHIPS is not a clinic that when you are sick you go and seek care. That is not the principle. The principle is that they do house-to-house visits. And then if there's an emergency, they give, I think all of them are covered. If there is a medicine that is at the CHIPS compound not covered, then it means they are not supposed to have it. Because they are supposed to have the paracetamols, even the amoxicillin is like this. The minor. So please, that is it. So, but if we are talking about we going and not getting the medicine and this thing, then we are defeating the thing. But let me also add that the community scorecard, this thing we are talking about here, it is not only implemented in the CHIP zones. It is being done at the health centers and then the district hospitals, with some regional hospitals that you are raising can apply. The concept. So for now, indicator, we are doing. And then in another stakeholder meeting, we can discuss it. So that is what is going on now. What in and not a routine thing. And what we are doing now, I think she mentioned it. Ghana is #1 in terms of the minister went for it. So, and that is why we've gotten several countries coming to learn from us about what we are doing. And one of the best practice collection system. So, and for that one, you can't easily add an indicator unless annually or every 3 years. So it is strictly, we don't have it because it's a uniform, standardized thing. Thank you.
As in this respect, or isn't there a better way either than transferring the person and transferring the problem to another place?
So I maybe wasn't clear, but then the community members don't want them. Then they transfer them. Sometimes familiarity breeds contempt. So they being familiar, and sometimes it's just they are aware of maybe saying that they want to even change. They want a change. So it will shock you that the same person in this community misbehaving will go to another community and will be the best. So, but then they are spoken to, they talk to them, not that, oh, yes, then they transfer you. No, it means that you're also going to cause problem at the other place. But then they talk to you for a while, and not like maybe the next quarter you didn't do well then. But if it's consistent, then you'd have to be.
So please, when you were answering, you said the scorecard is not meant for just the chips. So then it means that other health facilities can have access to it. Yeah. Then can be scored. Can be scored. Yeah. Okay, fine. So then does it apply to? It's not the best. So.
Yes, it's also applied to the private health facilities. But the system, the CHMC members, for the hospitals, Ghana Health Service is using the hospital management committees. The CHMCs, they come together, assess their own place, and then come together and assess the health centers. And then it is scored on the system. So the private facilities can also do that. But you see, the public sector, they haven't even supporting Ghana Health Service. The funds are not. When are you going to include the private facilities?
Soon. Okay. Thank you very much.
Thank you very much for the brilliant presentation. I say Senior Health Planner of Ghana Health Service and Mr. Emmanuel Ayire of the African Leaders Malaria Alliance. Well, they brought the coupons for the food, and we'll share them. So just stay at your tables for a while, and we'll share them quickly. Make sure you give it to them at the tables before we disperse. consultant of Alma, to take us through how to access data and information from the Scorecard portal. Connection, Unipower.
We are all welcome back. Yeah, I don't hear the thank you from others. To see okay, this projector, okay, it's like it's off. Oh, okay, all of them. Does not have access to the scorecard. What happened? You didn't get the email? Did you write your details? And your name? Samuel Mensah. Samuel Mensah, it seems I worked on it. Maybe Divine. Or I say, did you work on anyone? Who else? So let me take this table first. Your name? Spam. All of you, please check your spam. What is wrong? Okay. What is wrong about it? Oh, here. Here. Uh-huh. Okay. You said the name is what? Mm-hmm. I said on our Troy. Then who? Please, can I? Samuel. Okay. Yes. Uh-huh. Check your spam. There's and then who? Matilda what? This? What is wrong? Where? Here. This. That's all. This. That's all. Who else? Eh? Vera. What is wrong? What? That's correct. That's all. Huh? The name. Mensa. But the email was correct. This one. Okay, what is the problem? You didn't get it. Your name? Michael. Tay. Right? Is it correct? Check your spam. You are sure it's correct? The email is correct. Please check your spam. Okay. The web system. So the objective is for you to be able to navigate the system and get the information you require. That's the objective of this session. So that you can get any information you want. So please, if you also have a laptop and you want to be watching your laptop, and then if you have, maybe if it's one person having the laptop, it will be good you all use that. Okay, so if you are going, so I made the computer to remember my password. So use your username, and you can also use your email address to access it. And then the password, because mine has been remembered, it just came. So you only see this, you will not see this third one. So then I'm logging in. So it has taken me in. It's dancing too much. And then you can use mine to, if it's the account creation, to do that.
until all we have to send it. Just to does it. Or let's you log into this. Let him take this one. Log on to this.
Yeah, very good. You can use mine too.
He will log on to his. Then he will send mine. Okay. It shows that it's good.
Okay. So when you log in into the system, what you see, hey, this one too is the cable is not, so it wasn't my laptop. Okay. So when you log in, this is the, it will go off again. So don't they have a different cable? Where they are junior, you see? This is the cable. Where are this thing, the hotel people? This thing there is. Let's hope that it doesn't do that again. Are we together? So when you look up here, you see here too, very important. See, this one is already highlighted. You don't have the same page. That's why I was saying that as much as possible, use a laptop. The Android or mobile phone plat view is different from, yes, you see it like this. That's why I was recommending that you, yes, the mobile phone view is different from the main web platform view. So that's why I was saying those with laptops, open it there so that everybody can view, so that we follow. When I'm done with that platform, then we'll go to the mobile phone platform. I beg you, those with laptops, open them and log in so that you can follow very well. I beg. Okay, so this is what you see. So the first menu over there is active. That means that is where we are now. And this is what we call the scorecard view. The next ones, when we get there, we'll know what they are. Then you also have here community scorecard. That means we are viewing the community scorecard. And then there's something here which is saying that it has been published on the Scorecard Hub. We'll get to know what the Scorecard Hub is. And then we have what? Community indicator. There are 7 things here which we must know to help us appreciate what we are viewing. And then the color coding. So the first one, which is green, meaning that if it is on a particular indicator, a particular geographical zone, that indicator is doing well for that respective zone. Well, next one, which is yellow, meaning the indicator is making progress. It's not bad, it's not good. That's what it means. And then the next one is red, meaning that indicator is off track. They are not doing well on that. Then we have the next one, which is gray, meaning not applicable. And the next one, which is white, meaning there is no data for that. Arrow showing up and an arrow pointing down. The arrow pointing up means indicator. And then the arrow pointing down means there has been a decrease, either positive or negative, for that particular indicator over the previous quarter, in relation to the previous quarter. That's what those arrows mean, whether an increase or decrease over the previous quarter. And remember, the scorecard is populated on a quarterly basis. So whatever details you are seeing there is. So we have another important thing. When you come here, you have scorecard national unit, whether region, district, you can get all of them here. So these obviously are the indicators and their performance. Then when you come to the extreme right, very important. The extreme right gives you very important information which you need before you can do a very good write-up. The first indicator. That's why you see it highlighted. I hope you are seeing that. So once you put the cursor there, you see at the extreme right is an information about the first indicator. You can then use your cursor to move it to the next one. But the indicator is caring, respectful, and compassionate care. And then it tells you that the source you that the source of the information is from DEMS. Those having the laptops. This table do not have a laptop. You are watching this one. And this table they have, but they are not using it. What is the problem? No, this one. Our divine, can you pick my laptop? You can pick my laptop and give it to one of them. We have 2 laptops there. Because we need to understand it well. If you don't have you should have informed people to come with their laptops. Because this one there na computer work. Divine. Okay. So let's continue. You can give it to this one is not working. If you let it go off, it will lock again. No problem. They'll work on it. Once it's not there, there's no. Once it is new, everything new has challenges, so it's obvious, but it will be addressed. Hey, this thing. Okay, so I hope the thunder did not affect. to have your laptop. When you go to the first one, your extreme left, upper left, where you have Ghana. When you click on it, you see the various scorecards that we have. Currently, when you go there, there are about 7 over there. You have the community, you have the RAMCA, you have nutrition, you have malaria, you have NTDs, that's neglected tropical diseases, you have HIV, and you have TB. That's correct. So, and below that, you see the regions also. Are we together on that? No. I'm saying the upper left corner. Upper left corner, where you have Ghana. Right? I hope we all got that right. So the next one, which is the next one, we are going. Okay. Yes. Are we okay here? Okay. I hope you've gotten it. I said the upper left corner, where you have Ghana. Upper. When you click, it comes with the scorecards and then the regions cards before. Now the next one, we are going rightwards, where you have the scorecard there. I don't know whether you are seeing community. Yes. When you click on that one, it's the same thing you see. Have we seen that? So the two things are the same. The next one you see is towards the middle. And you realize that it is already highlighted. That menu. When you send your cursor around it, view is where you are now. What you are seeing is what you see when you click on it anywhere you are. Are we together? Now the next one. Yes. I said the next one. So the next, the sub-national view. Where are we? Boss, you people, you are not. I said you open it on your computer. Okay. So the sub-national view, it gives you a clear listing of all rows for all the indicators. And then it also gives you a trend. So it gives you a trend quarter by quarter, which you can change. Here. Hey. So go to your extreme right. Your extreme right. When you go to your extreme right, you see please, can you take this thing out? Yes. So, and you see options. Click on the options. So, you see you have Ghana. Click on that drop down and select Ahafo. From where? It starts with quarter what? Quarter 3 to quarter what? So you can also change that. No. Go down to where, yes. No. Hey, I think my eyes are better than you. Go to the drop down. Click on the drop down. So you see a trend. So you select the period of interest from where to where. So select what you want. So you will have first and last. So click on the drop down for the last. Which period do you want it to get to? So quarter 1, 2024. So when you have for all the indicators of that are on that scorecard, you can change the period as you want that. Okay. And also, if it's a committee scorecard, some started earlier than others. So wherever you don't see data, it means they probably haven't started by then. But the mobile phone view, if you select a long period, it will not pick. Okay. Thank you very much. So now, I think we have gotten this one. So you can change the region, and you can even select, you can go down. When you go to the option, you want to go to a district in Ahafo. Here. So let's say we were in Ahafo. And then the period was, the first period was, let's say, okay. So we wanted, let's say, quarter 1, 2022, up to quarter 2. So this is what we have. So now we want to go to a district in Ahafo. You go back to where you have Ahafo, and you click. The districts will drop down. You see them? You see? So okay, let's pick Asunafo North. So this is the trend. So you see that some of the areas they don't have data. Some areas they have data. That means the other district they did not do it. So these are some of the challenges. So maybe in Asunafo North, we want to still go down. So you go there, and then you see the sub-districts. So let's pick this. When we pick what? No data. You get it? So we can go down again. So you see? So you can go and go and go till you get to the community, to the last point. That's the good thing about this. Media access to this data, Masa, it no be easy. The Director General had to sacrifice a lot. So it means you are the blessed. Nowhere will the health system just give you access to data like that. They are guarding it. Hmm? They are guarding it with guns. Yes. So this is it. I hope we've gotten this skill well. Eh? I'm moving on now. So the next one is called the indicator view. Yes, sir. They didn't, yes, that's what it means. And let's also remember that the community scorecard, it is data from the CHMCs. They have to go and do the assessment, do the scores, and give the score sheet to the help team to enter into DIMS. So whatever you are seeing here is a reflection, a true reflection of what is in DIMS. And DIMS is the District Health Information Management System. That's a routine data collection system for the country. Okay. So, yes, maybe they haven't been trained. They may have CHMCs, but they haven't been trained on how to do the assessment. And I'm sure Isaiah told you that it is not all of them that are implementing. It is because of funding gap. So if you know an organization that can support, you can draw attention so that we can contact them to give us the assessment. You need to train them to do advocacy. Because just training them on the assessment alone is not enough. They have to assess, and when there are gaps, they do something about it. So that's what it is about. So if you don't train them on advocacy, how can they use the information to advocate for improvement of health services in their area? So you report and say, you know what the community scorecard is now. You talk about how the community scorecard is helping, because it has done a lot in several areas. But unfortunately, this district, these are the only number of people, facilities, CHMs that have been trained, and they are reporting and able to help. However, these other ones, because of funding gap, have not been trained to do the assessment and to be able to identify gaps to improve. So you are calling on what? You see now. So we go to the indicator view. The indicator view it gives us one indicator at a time. This thing. I hope you can see it. When you go to the extreme right, you see the options. So the options, by default, it takes us to the first indicator, caring and respectful care. And you can see all the regions here. And you can see the period also here. So now, I think it's the data, that's why our thing is not populating well. So you can also change the trend. You can change the trend here. So let's choose the indicator. Karen, the internet is disturbing us. Oh, it's not even connected. That's why. So that's it. It's connected. Thank you. Okay, so we are picking this. So we have this passionate care. So you see, we have a beautiful trend. So here, you can even tell the places that are not doing well. So regions that are not doing well are Bono East and what? Northern region. You see? So you see that, no, it's OT. So you see that OT, quarter 1, 2022, you see that it was yellow. And then it became red. And then yellow, 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 yellow. It's now that they are doing well. You see, so one can say that the implementation has really helped because the health facilities have been able to take action to improve over time. And then when you come to Bono East, it's a similar trend. But when you come to the Kerry, and then which one? Volta. You see it? They are yellow. You see that thing? And now, like I was telling you, so when you look at Volta, I hope you are seeing it. Volta. So you see that Volta, even though they are yellow, it's not good. But look at the arrow. Look at the arrow. Do you see the arrow? The arrow is what? Pointing down. So it means that even though they are yellow, it is worse against the previous quarter. So it means if they don't do anything about it, they will go to red. Excellent. So the colors are not enough. The arrows, very important. Hey, my people, we are still in a sub-national view. I said you should go to the next one, indicator view. We are talking about those things up. That's where we are. I hope you've understood me. So don't just look at the color alone. Look at the arrows. And the arrow is pointing down is an issue. And let's also remember the configuration of these things is based on the sector targets. So additionally, I think I left some very Get that. Forgive me. Let's go to the scorecard view. This one I'm not going to tell you. You have to go there. So I'm going around to see which table has been able to. Okay, excellent, excellent. Yes. You've also qualified. 10 marks. This group, no show. Okay, excellent. You've also gotten it. And then here, excellent. Yes. You've done well. This table, you haven't gone there. You didn't hear. I said scorecard view. Scorecard view is the first one over there. Yes. Okay. So now, This is the scorecard view. Now, when I told you by default, it goes to the first indicator. When you read below, you see what the indicator is, and then you also see the cutoffs. What gives you the yellows, the reds, and the greens? What do you see there?
Which one?
They are percentages. I'm talking about the extreme right.
Okay.
Where you have the indicator, go down. You see some things there. What does it tell you?
This.
Please, this is the Mona team. Red to yellow, 70. Yellow to green, 95. And reporting frequency is quarterly.
So, the red to yellow is what?
70.
Red to yellow. It means below 70 is red. That's what it means. Do you understand?
Yes, sir.
It means below 70, yes. And then you are 5 and a bed. You are what? Huh? You are green. Are we together? And then between, do we understand?
Yes.
This one is very important. Otherwise, you don't even understand what the colors are meant for. But it's very important for they are red. As a media person, you'll be able to say it is because the performance on that indicator is this. I hope we understand it. Kakra, kakra. This is very important. This is what gives us the color coding. And then additionally, at respectful care was 60. There's what we call percentage change. Percentage change. So the percentage changes on each indicator is different. Some of the indicators, a percentage change of 5% will give you the arrow going up or down, depending on the indicator. You know, it's not all indicators that you have higher figures that are bad. And it's not all indicators that you have higher figures that are good. You know that. If it is deaf, the lower percentage, the what? The better. I hope we understand. And if it's, let's say, for instance, antenatal coverage, the higher the percentage, the what? The better. I hope we are together. So, what gives you the arrows is the percentage change. It means there was a significant percentage change over the previous quarter. That's why you see an arrow against an indicator pointing down or up. If you don't see any, good. So we are going back to where we stopped. And we're at where? Huh? Hey, can I hear you? Excellent. Yes. So you have to speak like you are scholars now. Eh? So we're at the indicator view, which is this one. And here,
You can also click on a drop down at any of the regions so that it will give you the performance of the districts or sub-districts or communities. So let's go to Ashanti. So we are going to click here. They all dropped in. So we can see where we have data, where we don't have data. That means where they are implementing and where they haven't been implementing yet. And we can see the performance of the district. So we are going to see the sub-districts of one of the implementing to see whether in that sub-district they are all implementing or just some selected facilities. So let's click on Adanse. Okay. So you can see we have 2 sub-districts implementing. Do you see that? So let's go to one of the sub-districts and see how many facilities are implementing. So we go to the first one. You see that? You see the information. So you can go down till the list. So you can get all the information you need anywhere in the country. So once you have access to this, you have access to the whole data. So that is how you can navigate this. And like I said, you can change the period, the trend. You can change it the way you want. And the other good thing is that you can download it in PDF. If you want, you can take a screenshot. If you are doing a paper reporting, you can do a screenshot beautifully. Edit it nicely, fit it into your story. And then when you finish, you say source. You see? Yeah, you have to credit it. So here, you can say community scorecard or RAMCA scorecard. If you want, you can even add a link, www.rmncah.org. So, I think we are good with this. This one, we are saying that we are using a trend. And the trend, when you go to the options, you can change it the way you want. You saw that place. We are moving it from here. This is the scorecard view. This is the sub-national. This indicator. That's where we are. If you are not honest in asking your questions, you continue to get lost. In my language, they say that a visitor. Are we on the same page? So here, as I said, you can change the trend the way you want. You come to the period, first period, we want to see 2022. Immediately you change it, the data comes. One. If you want 10, whatever you want. I hope we are okay with this. So we are going to the next one. What is the next one? Who knows what it is? Excellent. It's the graph. You can also draw graphs. You can use graphs. And you can even compare them. So let's click on that one, which is the fourth one. So we have the graph By default, it gives us a line graph. And when you go to the options, you can put the data there. You can change it. And you see there's another interesting thing there, which you must notice to understand the line graph very well. Who knows what it is? Eh? When you are looking at it, there's something very unique, striking. Who knows what it is? Eh? Look well, oh. Look well and tell me. What is it? Well, I should put some money down. Hey, the line, you can't drag it, though. Hey, it's not dragging like that. If you are dragging, you are changing the figures, oh. Uh-huh.
Trend
analysis.
Not what
I want. No, it's good, but that's not what I want.
Hey.
Eh? You are not answering it the way I want. Uh-huh.
It is swinging.
Okay. Uh-huh. Uh-huh. Mm-hmm. But at the point you see that within that same green, it goes up a little bit.
Once again, this is the Mona team. The line starts on the green, and within that same green line, be it more than the first one, and when it gets to the last but one, it drops again. So in totality, we've realized that we are still in the green, but we can get about 3 or 4 different performances on that same green.
Yeah, give him a hand. Yes. Yes. No. So the answer that I wanted was that when you look on the graph, you see colors. The colors are talking about the cutoff for the green, the cutoff for the yellow, the cutoff for the red. So it tells you, the trend that you are seeing tells you that they are on track, as he's saying, at different levels of the performance. They are not on the yellow. That's the cutoff for the red. So you need to look at the colors for each indicator. And you realize that when you change the indicator, the zones for this coloring will change. Let's go to the next indicator and see what we have there. So for the indicators here, they all seem to be the same. But let's change it to a different scorecard and then see the cutoffs. So let's go to let's pick the nutrition scorecard. So we've picked the nutrition scorecard. Let's pick We have looked at Ahafo. Let's go to Bono. Is Bono here? So we don't have data. Let's go to stunting rate. Okay, let's go to. So we are still at Bono. So we have. Let's go to adolescent pregnancy. Have you seen the way the coloring have changed? You see that we have 0 to 13. Scorecard. No, when I say Ghana, I'm looking at the topmost, upper left corner. And then you click on the Ramka. Are you there? So you have to go to the indicator now and go and click and change it to the adolescent pregnancy. Go down. Don't click on the first indicators there. Those are national priority indicators, which are survey data. You may not get anything. So click on the Ramka again. Click. Then go to the indicator, where you have the indicator. Drop down, click on it. And go and select adolescent pregnancy. Go down to. Yes. Click. I said pregnancies. 10 to 19 years. Are you there? Are we all there? I hope we are not lost. I didn't say adolescent birth rate. I said pregnancies. The pregnancies. And we are also on the graph. We are on the graph. That's indicator view. Yes. We are at a minute. We are at Bono. So if you are not at Bono, you will see what I am seeing. It must be like mine. So, yes, Bono. And so you are there. Expect to see what I am seeing. I'm in Q1 2022. You are on the scorecard view. You are not on the graph. Look at it up there. Which the next one is the graph. So we are at the graph. And then you choose the period. You change the period. And currently, you are on adolescent birth rate. And that's not where we are, the indicator. We are on adolescent pregnancy. So that's percentage. But that's what the maternal health there is talking about. Maternal health in the go and select percentage adolescents ANC registrants and change the period. I started from Q1 2022. Bono, you are at Ghana. So we are not on the same page. So you go to Ghana, click, and you select Bono. You change, you are on maternal. Yes. When you go and select something else, things change. So you go back and select the right things. Are we together? Uh-huh. Where are you? Don't be confused though. You are on quad quarter. Quarter 1, 2022. Maybe you should change your spectacles. Are we okay now? Are we okay? We are now running. You are ahead. And why do you need direction? You are ahead of us. Huh? You are ahead. Hello. Okay. So the point I wanted to make is that depending on the indicator, the color margins changes because the indicators have different targets. But the community scorecard, all the indicators seem to be on the same distance. That's why I wanted us to go here so that you see how the colors here changes. You realize that the red here, very small. And this one is only 0 to 13. So when we change the indicator, let's change the indicator. So I'm changing the indicator to the next one, which is percentage of pregnant women registering during their first trimester. So when I select that one, you see the changes. You see how the colors change. The red comes down. Aha! Exactly. You see, so it means that the target is what? The target is 60. 60%. You see, so when you get 60 and above, you are green. And this is, I hope you are. Who knows the meaning of the indicator? Who knows the meaning of the indicator we are looking at? Huh? Please, so if you know, you know. If you don't know, you don't know. Who knows? You want to try? Okay. On behalf of no, the indicator registering during their first trimester. What does it mean?
It means that during the first 3 months,
Not exact. The one that's so let me give it to the next person.
I believe someone.
Don't worry. It's a good attempt. It's explaining. Who was it? You.
I said the number of pregnant women who registered during their first trimester. Their first month, 3 months of conception, no?
Can you give her a round of applause? So we are looking at the number of pregnant women who came for antenatal. So what does know they are pregnant? So that they will come late. They cannot get the needed help to ensure that they keep the pregnancies till the 9 months successfully. because you need to have enough time to even give them the tetanus injections, to give them the dewormers, to give them the hematinics, the folic acids and the others, so that it can get the pregnancy to be good and then the unborn baby to be healthy. But when you come so late, the tetanus, for instance, you need a number of doses for yourself and for your unborn baby to benefit. If you don't get enough, because you more women to come. That's why the more the distance, the better. So the cutoff here is what, 60. We need all of them 60. So that when they get to the 60, they will increase it again, 80, and then 90, 100, because all women should report. Because, please, this is very important. And it is important that you understand. Otherwise, you can't report on these things effectively for people to understand. Because there are some women, so when you don't go early, 6 weeks, you've aborted. You understand? So it depends. Because your system cannot take that weight. Because the child is growing. At a certain stage, it will go. You know, there are several women, anytime they get pregnant, they abort. Miscarriage, 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 miscarriage. You understand? So it's very important. And also because you need a number of interventions to keep yourself healthy. You have different colors here. So you need to watch out for that. Good. So this one, you don't even struggle to understand. That this one, they have been going on what? Red, yellow, red, yellow, red, yellow, red, yellow. So that's Bono. Let's see, let's go to another region. So you see, you can go to the district. But, so when you want to see the thing clearly, you go back and click on Ghana. And all the others will come up. Then you can easily go to, so let's go to Bono East. And you see that when you go there, the indicator jumps again. So you have to go back and select it. You see? So it means Bono East. Bono East to, oh, okay, this ANC registrants. We are talking about the first trimester. So let's go to the first trimester. So you see them. They are the Bono and the Bono East, they are all on the same. Let's go to we are Central. So we are on Central. So let's go back and select the indicator. Central is also like that. They are on, they started on red. Thank you. And then they've been moving within the yellow, yellow, yellow zone. Let's go to, so you see, you see that Eastern is good. So this is even a story you can tell. Because you know the Ghana situation. Ask Ghana Health Service once, even though they are not doing 100%, but the coverage is good as compared to several regions, the women and the men. Because it's the men that are releasing the women to go, isn't it? It's very important. If you take transport, isn't it? So if you don't give them transport, can they go? Okay. So, and you see, and you are covered. You are not the one saying it, but that's what Ghana Health Service is what? Is reporting. And then if you are also in a region where it is red, yellow, red, yellow, red, yellow, then you can say it. This is the situation. And because you are very conversant on how to drill down to the lowest, you say, okay, even though central region, we are on what? Yellow, red, yellow, red, yellow, red. But But this particular district is so influential that you can even ask people there to do what? To motivate the health team and to commend the system there. Because they have contributed to making it not what? Red. Because of their performance. Otherwise, the region would have chopped last. You see it? So this is a very important thing that you can engage your listeners to applaud you for doing what? Professional journalism. Addressing what? Real issues in the system. Instead of all the time the politics, which is not getting us anywhere. It's getting us worse off, isn't it? Okay, so I think enough of this. Let's go to the next one. The next one, which is the megaphone, is the most important aspect of the scorecard. You've seen it. Click on it. Are we all there? The megaphone. Click. Good. Yes. Good. Yes. Okay. You are all on track. So the megaphone, it is called what? I didn't hear you well. Is the most important aspect of the scorecard. That makes it unique. It's the most important aspect of it. It's not complete. The action tracker is a system that carries what they are doing to address the indicators you are seeing there. Some action must follow the indicators to address them. Looking at percentage of pregnant women going for antenatal within the first 3 months. It was bad in Eastern region, isn't it? So we need to go to the action tracker and see ANC, early ANC attendance. So if you go there and you don't see it, early ANC attendance. All the districts, out of all the 1, 2, 3, there was no action developed to address early ANC attendance. Or I did not see actions addressing the indicators apart from this district or this sub-district or this chip zone who developed an action to address or taking what? Attendance. And just what we have discussed. And you see, life has become too simple for us now. You don't need to struggle to write a story. Yes. Tell me what early ANC attendance is. And why is it important for women to attend antenatal during their first trimester? It will give you all the things. Then you use it to what? To add your story. And as a result of this, these people did so and so to address it. And we must applaud them. So you are talking about the action, that particular, and so let's look at an example. Let's see if we are going to, the Eastern region was doing well. So let's not go to Eastern. Let's select what? No, we looked at Central, and Central wasn't doing well. So this is the action tracker for Central. Are you seeing what I'm seeing? Are you seeing what I am seeing? Now I see their action, which is from where? Yes, answer for chips. Only one. So they are addressing security at the chip zone. So it means that the health system in the region have not developed enough indicators, enough actions to each scorecard has its own action tracker. There might be actions from the community scorecard that addresses late ANC attendance. Eh? Are we okay? And then when you go back and you click, it's when you come, you see that it is pointing up. The arrow have changed direction. When you click on it, then it will rearrange them. Rearrange them. Do you see that? And when you go down, you see the greens. Have you seen? Have you seen that? So that's one thing those things does. Now, the other thing it does is that it search the community you are in. So which communities will we search for? Huh? Savulugu. Eh? Nanton. Okay, all of them are okay. So let's type Savulugu. So when you start typing, it will even drop. So we are in Central. So which Central community should we type for? Huh? Saltpond. Developed. So no Saltpond. So those are some of the things you do. So in the community scorecard for Saltpond, or there is no facility implementing the community scorecard. Because if they are implementing, they should be reporting on the actions. You see, because this is what you have seen. And you can even say that I will be happy if the district director can come and explain to us why the facilities there are not implementing the community scorecard. Because you know that Ghana Health Service said all of. So the stories are galore. Eh? Stories galore. You can always come out with stories. Plenty. Very nice, educative, developmental oriented stories. Eh? And your duty is to contribute to what? Sustainable development. Isn't it? Okay. So now we can also come here at the bottom for actions related to antenatal. So we can type A and C here to see. That means there hasn't been any action developed which the bottleneck was A and C. So like I did earlier, let's come to the action description itself and type A and C. Not so we type what? Antenatal. So I haven't even finished, but it's not there. Do you get that? Good. So these are skills that you need to complete your story. And please, for the emphasis, I'm saying that each scorecard has its own action tracker. Currently, when you look up, is what? Action items for Central Community Scorecard. So, and Community Scorecard is here. So if I click here, I can change it to what? Ramka. Yeah, this is it. So you see that for Malaria Scorecard to Central Region. Straight to, you want us to go to Upper West? Okay, we are in Upper West. So Upper West, for Malaria Scorecard, only one. Let's go to Ramka. Ramka Scorecard, there are how many? 7 plus 5 plus 8 plus 7. That's not enough. I don't know. There. Nutrition, you have 69, 26, 68, and 1. So they have more actions in the nutrition scorecard. You see. Plenty. So that's how you navigate the system to get what is there and what is not there. Are we okay? I have not been checking my time because I need to. I'm almost. I think I have how many minutes? Mr. Eunice, my time is not yet up. It's not up to 5. Okay, you are giving me your. Okay. Okay. So now we'll end this one here. And I'm introducing you to something else. And that one, we are going to end it with an assignment. Take home. So, where you are now, watch me. So when you go to the extreme upper right, you see this, and then you see this, the chart symbol. So we are clicking on the chart symbol here. Whether you are at the scorecard area, wherever, is the same thing. So here, you click here, it will take you to another web page. Please, can we click there? You are there. Wow, that's good. And the Mona team. Okay. And the network. Yeah. Okay, you are there. That's good. My people, are you there? Yes. This team, good. Yes. The network is disappointing you. Hey, then you miss this one. Oh. That's the one you do and get a certificate also. So if you don't get a certificate after this training, we print it, and the big people will do a presentation to you for graduating. Yes. So it's very important. If you want the paparazzis to capture you, there's also a person has graduated successfully after undergoing the community scorecard training to empower serious one with the reporter picture, and then Ghana Health Service gloriously handing over to you. You see? Okay. We are going there now. So we are here. The Alma scorecard, your knowledge and skills on the scorecards. So we have webinars, we have online trainings, we have best practices, and a whole lot. So, but you need to create an account for yourself. That account is different from your main account. Here, when you are creating your account, your name should be written the way you want it written on your certificate. If you make a mistake, the system will give you that mistaked certificate. So you write your name the way you want it. And this one, you can even add it to your CV. If you are going for any job, you can say it. You have undergone this. When you are going for interview, you can submit it. It's very important. And this one is from the African Union. So you see, it's big. So we are going to create the account. So you go down. Okay. So to get it quickly, you go up here. You see where you have sign in. You've seen the sign in up here. So I'm clicking on it. I have clicked, and this is what comes. You only need to sign in to take an you've seen it. We only ask for your name, email address, and password. Are we together? Are we there? Which team is not there yet? I said you click. Okay. I said you click on the what? You have to click on because you don't have an account yet. So if we are here, what we need to do is to click on this. Use your phone. You can use the phone. You can get it. You can use your phone to create the account and then do the online course. You can do that. So for the URL, you can type www.scorecardhub.org, yes, and it will take you there. Alma Scorecard Hub. Scorecard Hub. HUB. B for boy. Alma Scorecard Hub.org. So you can use your phone to create it. Can I go on? Yes, sir. Can I continue now? Click on create account. This is what you see. So you type your name, as I said, the way you want it on your certificate. If you make a mistake here, it will give you that distance. So make sure you put your official name there. They will tell you to bring an affidavit. So you put your name there, your email address, and you create a password. If you want, which I would recommend, you use the same password so that you don't forget them. Use the same password you use for the scorecard so that you don't forget it easily. And then when you finish creating it, you click on yes, I have read the terms, meaning you have accepted. And you click on what? Create. It will send you an email, just like are we okay? Yeah, Divine, you can also help those having challenges so that you are putting in your actual email address. Because when you finish, the system will send you an email before you can get access. If you use something else, you will not be able to get it. Your email is full. This one there, I can't help you. They want you to buy space. They want you to. Now they are beginning to commercialize everything. Yeah, if you don't get the email, you can't activate it. Was a subscription. So if you don't do it well, so what you did, so you go, I said you go to here, sign in, and then you go to create account, and then you put your name, go to spam. Nothing. Because you need to validate it. Without validating, you won't get this. This is a subscription. So, because you didn't say yes, you didn't. Refresh it. Your internet too. Let me see. Let me see which one. Not an account. You are subscribing to news and other things. So you see this one. You don't. You have to go to. And then you click on create account. And then you type your name. So you put your name. Are you through? Let me see. So, did you? You know, when you are successful, yes, when you are successful, and it is the main web platform where you have sign in, it will change to your account. The writing will change from sign in to your account. And then in your email, it will send you an activation email in your email inbox or spam. You click on activate. It will take you to the platform where there will be a code for you to activate. When you go down, you see it. You click on activate, and then it will activate, and the sign in will change to your account. That is when a subscription. Yes, complete the activation of your account. So you click on that link. When you click on that link, it will take you there, and then it will ask you to activate. You click on activate, and then you are in. Yes. Yes. Okay. My people, are you fine? Not all of you. Okay. You are true. Excellent. Yes. That's good. You are doing well. Uh-huh. Yes. Good. Let's give a little bit of time successfully. Then we can go to the next step. That one are just two things that we are good. Yes, yes, yes. Yes, you're on the right track. Let's go to the next step. So, the next thing, I am going to click on online courses. I have clicked on online courses, and this is what I see. Are we there? Are we there? Yeah, online courses. Yes. So then we go into the search. Then we type Ghana. Type Ghana. Because we are in Ghana. When you type Ghana, you see what? 86 results. 88, okay. You have 86. All right. $500 and something. You have to click on online courses before you go to the search. Let's take note. You click on online courses before the community scorecard. So when we come here, we see courses. There are 5 courses. So let's click. When we open the courses, we'll see Ghana NTD's training. We'll see Ghana Community Scorecard training. We'll see Ghana Parliamentary Select Committee training. We'll see Malaria Scorecard doing here. The community. So we'll click on community. Seeing will be a little bit different. So, and these are the training courses. So you have the agenda, number of modules that you have to undertake. So you have to do this one, the country scorecard management tool overview. You click here to see the community scorecard overview. And in that order, you have to finish all of them. So you see that there are about three or so models. You have to complete the 3 models, and you have to get a score of at least 80%. So 80 and above before you can get the certificate. When you finish and you get 80 and above, it will automatically send you your certificate via email. And then you download the certificate and you send it to the organizers. It can be printed and presented to you during the closing session. Come again. Oh, you can attempt as many as you can. Plenty. So if you are able to do it successfully and you send your certificate to the organizers, you will have the privilege of being presented to during the closing session. If you are not able to, I don't know. That one. Yes, and many more. Yes, that we haven't been able to presentations and video commentary so that you can understand it very well before you take the quiz. Reverse gear. Up to where?
turning up. Now we'll take a group photograph. And the idea is we'll clear the space in front of the strategic banner we have there. That's where we take the picture. So we try and clear that space. Take the picture before we grab our takeaway for the night. So in the next few minutes, we'll put our shoulders together, clear that space for the picture.